Dude, Marty! Welcome back, man.
It's good to see you, Marty.
We just launched right into it. VP, ZD, MM, double M.
Double M.
Great to see you guys. With the three horsemen are back to cause harm in the universe.
I had so much fun last time. So many people came up to me and said, it was just fun to watch the interaction and banter.
People like the show. People
come up to me with like a white glove and slap me across the face, challenge me to a duel, dude. Who are these people that are talking to you?
They're racist if they're using a white glove.
Thank you. There's an equity issue here.
But they, I think people learned something last time. They may have decreased in knowledge.
No, they learned. You were dropping facts on their head, Marty. They weren't ready to hear them.
Hey, I'm a fat guy.
You're a fat guy. We're all in the news business. I know, right? I'm in the news business.
I've had faxes dropped on my head. That's the difference. It's funny. Knowledge can neither be created nor destroyed according to the first law of thermodynamics, and yet we managed to destroy knowledge in the last episode we did. I mean,
you know how you can add these arbitrary titles to what you are? Like most people decided to add epidemiologist to their credentials.
I'm a euchronologist now.
Trust me, I'm an epidemiologist.
Yeah, exactly.
Yes. Right, euchronologist. Yeah, that's a new specialty that's emerging on Twitter. Yeah, I see them.
So my latest is I'm adding fact checker.
Of course.
You guys can be fact checkers too.
You have to already have a strong point of view and be unwilling to reconsider it. That's the key.
That's a key thing.
That's a key thing.
You have to have strong opinions.
Yeah,
in order to be a fact checker.
Actually, this is important. So a friend of mine, Daniel Schmachtenberger, wrote a piece on his consilience.project.org website about the dangers of fact-checking. and seriously, we know we're in an information ecology that's so fractured you don't even know what's true anymore. Like, I don't know, are the Ukrainians winning? Are they losing? Am I bald? Do I have hair? It's not clear. So there are three kind of things that you can do with fact-checking that can mislead people, even with real facts. And one is the failure to contextualize the fact. Right? So we see this all the time. Like, here's a study. The study shows, without a doubt, that masking a 2-year-old prevents apocalypse.
It's a parachute. So
it's a parachute. You don't study a parachute. You just know it works.
You selectively did choose the things you don't want to study. You call them parachute.
Of course.
Issues, right?
That's right.
It's a hallmark of medicine. We published a couple of papers on this where we looked at people who claim their medical practice is like a parachute, and it's almost always something that could easily be assessed, and 50% of the time it has already been studied in a randomized study, proving it ain't no parachute.
So for people listening, you may not know, the parachute argument is when you say, well, we don't do a randomized control trial with parachutes. It's just so obvious that they're effective. So people selectively use that to say, look, I believe in this medical dogma, and there's no need to study it because it's like a parachute.
Exactly. And so the parachute of masks for 2-year-olds.
Cloth masks.
The cloth mask. The good one.
The one that everyone's wearing.
Right. No, but the truth is the majority of people in this country who wore masks, to this day, it's still cloth.
The last people in America forced to wear cloth masks. Kids toddlers. 2 through 5.
Yeah. In New York City and other places.
Servers, waiters, staff.
So
the least powerful people.
Yeah, the defenseless.
Oh, speaking of least powerful, defenseless people. So my daughter, a middle schooler, age 14, they just got rid of the mask mandate, public schools here. Yet every single child in her school wears a mask.
They don't want to piss off the teachers.
So this is what happened. So my kid's in class.
Teachers grade them.
And they also form unions where they say, you know what, it's okay if school is closed for a year. If they don't catch up with their timetables, that's okay. But what they did learn was what was important, like the words coup and insurrection, which it's really, school is not about accomplishing knowledge. It's about understanding your social purpose, diversity and inclusion, and social justice.
The greatest domestic policy failure of this pandemic in the U.S., there are many failures. We'll have to have a contest for but I'd say the greatest is school closure 1 year.
Yeah, I would say that's number one. School closures, forced cloth masks on kids, ignoring natural immunity, surface transmission instead of aerosolized virus, the interval between the 2 doses.
Oh, that's another one.
That's a good one.
I would say
that's it.
That's a partial list.
That's an opening salvo. Yeah. Okay, I see. Oh, boy.
Yeah, draconian hospital visitation
and that was
policies.
that too. Yeah, we talked about that.
Boosters for children.
Boosters in young people with no data to support.
Oh, that's true.
Yeah.
And you want to boost in the most young people and not boost the elderly. That was apparently the new strategy.
Basically, the one-size-fits-all thirst.
That wasn't good.
Public health officials want a single message to apply to everybody.
But that's what that's what they say as their justification for why they have this backwards protocol. But the truth is, there's so much complexity already. For instance, if you got Pfizer, you got 30 micrograms, 2 doses, 21 days apart. That's what they wanted. But if you got Moderna, it was 100, 28 days apart. And then initially, the Moderna EUA for booster was after 6 months. Pfizer was 5, but then they homogenized that using Pfizer data for Moderna. So my point is just, and then J&J was initially 1 dose. Then, of course, they wanted an mRNA booster after the 1 dose. My point is just that we have always tolerated complexity. The problem is, for the complexity they don't want to acknowledge, natural immunity complexity, or the fact that younger people have lower risk than older people, the complexity they don't want to acknowledge, then they say, you can't handle that complexity. You can handle all the complexity we want you to handle, but not the complexity that we don't.
And this, again, is how you lie with facts.
Yeah.
So the idea that you decontextualize a fact, you take it out of the context of, well, what were the limitations of the study? What are the limitations of the data set? What is the actual context of the civilization you're putting this data into? All of that. You take it out and you go, hey, did you know the study showed that masking a 2-year-old means less COVID? It's like, but. So that's one way to lie with facts. And we've been lied to with facts, I think, for a lot of this, don't you think?
You guys
on all
are
sides
using
of this, COVIDian and COVIDiot side.
You're using data now and facts, and
It's taboo.
you really shouldn't be doing that. You should just come up with you should meet with the marketing department and come up with an easy message that everyone will be able to follow without asking any questions. I heard this interesting analysis.
Burger King, have it your way.
Yes.
Brilliant.
Learn from the king.
Yes.
Yes.
That guy had it right. He was a little dysmorphic, a little shady looking, a little frightening to children. But
There's a Burger King avatar? Oh, I
there
remember
is a guy.
now.
It's a weird dude.
Weird looking dude. Yeah.
Dude, just grill the burgers and shut up.
Man, I'll go with Grimace any day over
Dude,
that.
Grimace.
Grimace.
That guy. Okay, let me tell you about Grimace real quick.
Yeah.
He's
That's
purple.
McDonald's, isn't it?
Yeah, it's
Miss
Mickey D's.
McDonald's.
That's
Okay.
Mickey
You're
D's.
shifting
Grimace,
here.
Grimace had central obesity, purple striae. He was a little psychotic.
Type 2
Grimace,
diabetes.
He had type 2 diabetes.
You think he's
He's Cushingoid.
I think so.
He had adrenal storm.
Can you
Some kind of storm.
Can you resect
Lots
that,
of
Marty?
storms
You're
going on
surgeon.
in
Can
there.
you resect that too?
Yeah, we can do a sleeve or a gastric bypass on
Oh
Grimace.
no! Why don't you get to the source? Take away the adrenal.
No, we don't want to deal with the underlying issues that bring people to care.
Listen, ever since the Hamburglar had his Whipple, it's been downhill since then.
Don't talk about food as medicine and school lunch programs. We only talk about surgical outcomes after bariatric surgery.
That's a good point. That in many ways, like the fact that as a culture, we've never really dealt with the obesity epidemic at the root level of, the kinds of processed foods we feed kids and the terrible school lunch programs we offer. And we want to deal with it with this kind of last ditch solution. In a lot of ways, it's kind of similar to COVID-19, not getting to the root causes and the root
That's
problems.
right.
Yeah.
And that's the exciting thing right now. Doctors, I find, are dying to reach out into the community, get out of the bounds of the walls of the hospital where they treat things at the end, last stages of illness, and start to talk about cooking classes for people with diabetes and stress management and sleep medicine applied to high blood pressure management, stuff beyond just sort of the whack-a-mole once they come in with the problem. So that's an exciting trend. And it does apply to COVID. The interesting thing I heard about COVID recently from an HIV scientist was that we all bring our biases to any problem in medicine, right? We all have our approach. I mean, basically, the people in charge of COVID policy, the people making all the decisions, are basically HIV doctors.
Okay.
And so with HIV, there was no natural immunity. With HIV, the risk was equally distributed in the population in their mind. That's at least direct quote from Dr. Fauci during the AIDS epidemic, was that everybody is at risk.
Yeah, I remember him saying that.
So, here you have an infection where there is natural immunity. It's effective. It's real. Here you have an infection where there's a 10,000-fold difference in the risk between an older person with comorbidity and a young, healthy teenager. And yet, so that natural bias, it's not suggesting people weren't well-intended, but they're bringing maybe the biases from that HIV perspective in managing that epidemic to COVID.
And what's interesting is when you see the exception to that where she took her HIV bias and actually applied it correctly, which was Monica Gandhi.
Yeah.
So Monica says, we learned this in HIV. You don't shame people. You don't mandate things. You teach people, you give them the tools, resources, and autonomy to make these decisions, and then they do it. We never forced condoms on gay men. We never forced abstinence on you. We had conversations with them as grown-ups. And And we haven't really done that very well in COVID. In fact, we understand risk so badly. To circle back to my daughter's story in the classroom. So everybody's wearing masks. My daughter says, she feels pressured to do it, so she's fine.
Even though there's no requirement.
There's no requirement. Everybody,
it's the polite thing to do, Marty.
Everybody is double and triple vaccinated.
Do they know what life is like without a mask? I mean, some kids that are 5 years old.
My daughter entered middle school as a teenager in COVID and has never, had a year of remote class. And then so the teachers so one student has the audacity to take their mask off in the class.
Oh my God.
The teacher said, Billy Bob or whatever your name is, if you're going to take your mask off, I'm not comfortable with that because I'm high risk. She's my age, triple vaccinated, or
triple
she
vaxxed,
or she.
Yeah.
And
high is a relative term.
I'm going to put you next to the door. So I'm going to move you. It says this to the whole class. Move you to the door. Why
the door, not the window?
Good
question. By the way, all the windows are open in the class during the winter.
Really?
They're all open. Yeah.
You have to exhale through the open window because they're high risk. Gosh.
Wait, hold on.
Yeah.
So they put them by the door.
They put them by the door.
Where the air is stagnant.
Where the air is stagnant.
Okay.
And all this, and my daughter comes home and tells me this story, and she's like, I feel really bad for this kid. Like, he didn't do anything wrong. I'm like, you're a smart girl.
To show his face.
But you know who did is the person who doesn't understand risk. Well, and that's what we're getting at here is risk.
But don't you feel like, we've conditioned, we've conditioned the teacher into believing this in a few ways. Number one,
it's not their fault. Yeah.
Yeah. It's not, I don't think it's the teacher's fault.
Yeah.
It's kind of a cultural thing. Like where would I trace the root to? Obviously anxiety was through the roof in March and April 2020. People wanted to do something. And even though the entire pre-existing body of evidence was quite critical of cloth masking, which is why the WHO and CDC didn't recommend it initially, people wanted to do something, and there was a strong advocacy movement. There's been a great article about this called The Mask Debacle in Tablet Magazine, and it really kind of unpacks some of the history here. And so then people jumped aboard. But of course, to jump aboard and make a switch this big, you kind of got to be a propagandist and kind of really sell it. And then quickly by the summer, masks were a symbol of virtue. Trump didn't wear his, and of course he's the bad guy. He's the horrible person, so we want to do the opposite of him. So in the liberal place, like where we're located,
anything Trump does, we'll do the opposite.
We'll do the opposite, and really hard to prove how much better we are than him. Obviously, that's the philosophy. And so then this person digs in more. They're in a culture where everyone they're talking to talks about how important the mask is, and then the next thing they know, they're behaving the way if you really stand back and think about it, it's quite cruel that a teacher would to single out a child. To make them feel, I can imagine this. I feel bad for this kid too.
Yeah.
Here's the thing.
And the kid is right.
The kid's right. That's the thing.
It doesn't hurt that the kid's right. They're all vaccinated in that school, right?
Oh,
they're
mandatory? They're all boosted. Except for my daughter. Shh.
Oh, well, yeah. Don't tell the museums.
Oh, yeah. Don't tell the museums. I know, they come after me. First, they came for the zoo. Then they came for the museums. Then there was no one to back me up for my unboosted child.
I think the museums are having their own panel to discuss the Moderna data that dropped today. Because you want the museum should be the first person to decide on the new vaccine data. And then let's go to the
Tell me about this data. What's going on with Moderna?
You want to talk about that?
Okay. I was going to say, the distorted perception of risk out there. So did you see this study of a journalist who studied bicyclers in Palo Alto? And he found that 46% were wearing a mask while riding their bike.
On Stanford campus.
Right by Stanford campus. He was at an intersection. He measured it. And only 17% were wearing a helmet. Right? So there's this completely distorted perception of risk. And, you're being, I think, appropriately kind in saying people have a distorted perception of risk because of the messaging that's being sent out. Sonia Sotomayor probably truly believed there were 100,000 kids in the hospital at the time.
Are you saying that number was a little off, Marty?
Well, I think it was 1,300 at the time. And no one's distinguished.
Just a little lower than 100.
The thing is, the CDC still can't tell us how many were for COVID versus with COVID.
They just acknowledged they were wrong about the number of children who've passed away with this virus. Did you see that?
They cut it by 24%. The total COVID death tally in the United States, the CDC just cut by 24%. And they still can't tell us how many were for COVID.
We're not talking about something fancy math. We're talking about counting.
Right. And here's the thing.
Now, I'll just say this. I'm going to play devil's advocate. No children should die.
Of course.
Children don't die.
Right. And children die from more than COVID. They die from profound isolation and mental illness and homicide and suicide.
I would argue they die from not knowing their times table. In other words, poor education is correlated.
That's been proven. Many studies show that failure to attain sort of these traditional educational outcomes like mathematics and reading are profoundly tied to life expectancy and upward mobility and these things. That's health. Learning your timetable is health. It's a type of health. It's to get around this world.
I agree.
But Marty, back to your
especially if you're Asian or Indian.
We were born knowing it.
Because I'll kill you if you don't learn your times table. I mean, it's a health. It's an existential risk.
My dad would always kind of make special equations for us to study at home, and he's like, "Why are they only teaching you one variable? Let's get another variable in there. Come on, let's make it a little harder." But to your point, Marty, no helmet, wearing a mask. Maybe there's no reason to protect a brain that's not working when it's riding.
Well, Marty, but the bottom line is those helmets have big holes in them. They're going to let virus right through. Why would you waste your time wearing that?
But I just gave this talk, at the Society of Gynecologic Oncology, SGO.
That must have been fun.
It was good. I
actually bet it was a lot of fun.
I learned a ton. When I'm at these meetings and specialties outside of my own, I learn a ton. I love learning. And so they were telling me about some of the new chemotherapy pathways. I was talking to some folks about the uterus transplant operation. Evidently, they've done 20 of these at Baylor. And they transplant the uterus. The individual gets pregnant, and then they remove the uterus afterwards. So
you don't get rejection and all that.
Yeah, you don't have to deal with immunosuppression. I mean, it's amazing. We have a protocol at Johns Hopkins to start this.
Yeah. So could a male get a uterine transplant? I mean, a genetically male.
How dare you ask that? Actually, I asked the same question when I heard this. And
because I'm thinking it's time for Z-Dog MD to get hurt.
We need
There's
more
got to be some
Zs.
vetting process.
Exactly.
We need more Zs in the world.
Yes, we do.
We definitely.
So what's the answer to that question?
There's discussion about it, but it's not part of any current protocol.
But I guess even if they did that, they'd have to do a lot of hormone regulation too.
Yeah,
you would think.
Wasn't this covered in an Arnold Schwarzenegger movie?
It was called Twins.
Was it? Yeah.
No, it wasn't Twins. It was I forget, but it was awesome.
I thought it was a Schwarzenegger.
Anything that Schwarzenegger does is scientifically
and by the way, he had a
Terminator.
Did you see his talk thing on Russia?
Oh, it was crazy awesome.
Really good.
Yeah. He's like, listen to my friends in Russia. Hear me now and believe me later. They're lying to you. Putin is a bad man.
But it was a great story about that inspirational story.
Does he wear a helmet when he bites? I don't know if there's helmets that large.
For Arnold?
If you wear a lot of masks, it functions as a helmet.
If you put them around your head, an outdoor mask in the Palo Alto breeze. Yeah. What are we doing?
KN95. It's got to be. I wear a KN95. My nose hangs out, but I wear a KN95 below my nose.
That's because you have seasonal allergies. It's for the pollen.
Yes.
What I love is that people are wearing these things, but they're not fitted like we have in the hospitals.
No, they like to have the nice big gaps right here by the nose, so it's easy.
It makes it so much easier to breathe if I just open it.
Does a KN95 below the nose function better than a cloth mask below the nose?
Oh, great question.
That's a good question.
No one studied it.
Needs a study. It's a parachute. Don't study it.
It needs a mannequin study in a chamber. In other words, what the CDC calls the gold standard for public health.
Yeah. Speaking of which, sorry, that's the second. I'm going to keep weaving these in. The second way to lie with facts is cherry picking data and just pulling particular data sets and saying, well, see, the studies show this.
Classic.
And you're ignoring all the other studies that
the
show
Kentucky study by the CDC on natural immunity that spanned 2 months.
If it's an MMWR, it's the Lord's truth.
It is the Lord's truth.
It's the Lord's truth. MMWR, I've heard some people even say that it's the best or the greatest journal. Would you call it the best or the greatest journal?
It's the #1 best journal that the CDC publishes.
There's only one peer reviewer, and his name is Lord Zero COVID, to whom we all hail.
Lord Zero COVID,
So
they've published some bad ones lately. I have to point out one. There was one about the efficacy. Oh, no, I'm sorry. That was pediatrics. I'll come to it later.
Oh, yeah, I saw that. I saw your thing.
Okay.
So
I'll leave it alone for now. Yeah.
This meeting was great, the SGO meeting.
Oh, yes.
And Vinay gave me some slides to use. I told him, I'm like, look, I'm talking a big oncology meeting.
I sent him my slide deck. I sent him my full Google. I gave you my access to my whole cancer slide.
You guys are like
I went through
brothers
hundreds of slides that he had in his Google Drive.
Gosh.
Hundreds. And out of all the slides, first of all, it was very difficult to interpret the slides without.
I was like, I hope he understands coefficients of determination because it gets into the weeds. It gets into the weeds.
Why is this just a slide of Big Bird? Where did this come from? Like, why is that even there?
Spices. I saw the spice.
It was spices. That's
nice.
It was like trying to.
He did look at your slides.
So
it was like trying to read the freaking Rosetta Stone going through your thing. So I found there are a couple of facts that I pulled. One was that 8% of all cancer patients are eligible for genome-specific treatment.
Yeah, that's a paper that we published in JAMA Oncology.
That's a lot.
Mark Hart et al. And
is it still around 8%, you think?
we updated it in the Annals of Oncology. I think it's up to like 10%. But I think the point is that, the way they talk about it on the news, you might think the majority of cancer patients would be eligible for a genome-targeted drug, but it's still, 1 in 10. Still quite modest, yeah.
I'm actually surprised it's that high.
I guess because you're a realist.
No, you are. Right.
The other soundbite I pulled out of your hundreds of slides that I sifted through with my Rosetta Stone was that if you do 100 trials, about 5 are going to give you a false positive. So
yes, if you use a one-tail p-value 0.05. If you use a two-tail p-value, it'll be 2.5. But yeah, your point's well taken.
You wanted to use a p-value that's going to give you the most likely chance of an FDA approval, right?
That's what they want to do. Yeah, one tail works. Echelon. Yeah, go on.
So it cost about $2.2 million to do a trial.
Oh, you like this. Okay,
and so if you want to do 100 trials, it costs $2.2 billion. That stuff's sloshing around Wall Street all over the place and San Francisco. And so if you do 100 trials for $2.2 billion, you're going to get at least 5 false positives, and they will pay out how much? 1 to 50 billion each.
Yes.
Of those false negatives. And then of those that are positive on the response rate as the endpoint, the tumor response rate, something like 5 to 19% actually correlate with an improved survival. Most don't.
Yeah. Oh, wow. I'm impressed that you've gotten all these from these slides with very little text on it. So I'll say about this. So we published this paper a few years ago, and actually the New York Times did an editorial on this paper. And the paper was a sort of a thought experiment. And the thought experiment exactly as Marty says, which is that we know when you run all these randomized controlled trials, you tolerate some alpha error or some chance that by chance alone, if the drug was totally inert, you would see this result or a more extreme result. That's the p-value. And we basically hypothesized, let's say we actually ran a portfolio of inert drugs that just didn't work, but we just ran many, many of those. There's going to be some false positive rate. We're going to find some of them work when they really don't work. That's just the vagaries of statistics. And then we started to do the math on how and whether or not, could you actually run a profitable company just testing inert substances? And I use the visual of spices from a spice cabinet, things that I don't really think help metastatic cancer patients. And the answer is, with a number of plausible assumptions, you could turn a profit because the amount of money we give for every approved cancer drug is so much. I think we're talking about life cycle earnings, 10 to 12 billion. And
it's not just cancer, right? It's the Alzheimer's drug. They're rolling the dice.
Yes, and
it's a financial rolling of the dice.
I think you're hitting, I think it's such a profound point, which is that we have lowered the bar so low for drug products in this country, and we have set the revenue post-approval so high that we're incentivizing very, very marginal programs. And I actually don't believe they're testing inert substances. I think they're better than that. They're testing things that actually do work, but you don't have to be that much better and totally worthless to generate huge portfolio revenue. And that was the theme of this paper in Nature Advanced Drug Discovery.
And again, that gets to the systematic biases that lead us to bad outcomes in science, which, of course, our entire healthcare system is one big systematic bias against good outcomes in this country, fee-for-service medicine, all the money we spend, disjointed, siloed, crappy EHR, the whole 9 yards, right? And then what we do is we throw the frontline healthcare professionals under the bus when shit goes south. Right. So have you heard about this story about RaDonda Vaught? RaDonda Vaught.
The nurse at Vanderbilt.
Nurse at Vanderbilt. So she's an ICU nurse. And
amazing story.
Really nutty story, because I talked about this a few years ago when this first came out, when she was charged criminally. Okay. So she's an ICU nurse, by all accounts of her colleagues, wonderful, competent, amazing nurse. One day she's working, 75-year-old patient, needs to go down to the scanner, CT scanner, needs to be sedated because she's claustrophobic, all right? Now, she's got a trainee with her. Vanderbilt just did some epic nonsense, their big EHR, and it was a total cluster F where their Pyxis, the machine that dispenses medicines, wasn't communicating with Epic. And so you had to enter these overrides in order to dispense the right medication.
Vanderbilt's the only place where it's been a cluster, by the way, in the country.
Everywhere else had a swimming rollout. Epic rollout has been swimming.
$1 billion transition.
Anybody else who spent $1 billion on Epic got what they paid for. $1 billion worth of amazing quality improvement.
Brought to you by Epic.
Yes. No, Judy Faulkner, president of Epic, says. So long story short, she's down in the scanner. They need to sedate this woman with Versed, which was ordered. Yeah. She tries to pull Versed. It doesn't come out because of the misgiggling of the thingamajig. Epic. Probably something related to that. She hits override and then types in the first 2 letters of Versed, VE. It pulls out vecuronium.
Ooh, paralytic.
Which is a paralytic agent. Serpent in the rainbow level stuff. Will paralyze all your muscles, but you're wide awake. She then dispenses it, is talking to the trainee about how to do overrides, And then there are several different failure points here because vecuronium is a powder, Versed is a liquid. You have to reconstitute the powder. On the bottle, it says, warning, paralytic agent. So she blows through those warnings for whatever reason.
I can't tell you how many warnings I blow through, by the way.
Because it's called alarm fatigue.
Alarm fatigue.
Alert fatigue.
The whole epic is nothing but a warning.
Yeah, 16 alert warnings before you prescribe aspirin.
Are you sure you want to give Tylenol with a Band-Aid? They can interact. It's stuff like that. It is. It's like these ridiculous things. I made a rap video about this, EHR State of Mind, talking about exactly
this. It's nothing but alarm fatigue and anyway.
And fatigue.
So I relate to this as you talk here. I relate to making mistakes.
And exactly. So in fact, not only do you relate, but I've gotten.
You've never made a mistake.
No,
before,
Marty doesn't make mistakes. No, he doesn't make mistakes.
I mean, you could have if you were.
He causes mistakes.
I made a mistake once,
and it was a mistake.
Yeah, I thought I was the second most humble person in the world.
I thought he was about to say I made a mistake about 30 minutes ago when I joined you guys on
exactly.
I made a mistake 30 minutes
I made a mistake, and the mistake was thinking I'd made a mistake.
No, but
very humble.
I think you're right. I mean,
I'm the most humble person I know, but go ahead. I'm sorry.
The humblest.
Yeah,
no.
But you have reason for it.
So she reconstitutes the vecuronium, gives the vecuronium, pushes this lady into the scanner. She dies in the scanner, awake, suffocates. I mean, horrible. The worst thing you could ever imagine.
Yeah, terrible.
And it was immediately, okay, this is what happened. And she was fired instantly, which, by the way, is not the standard.
It's not how we deal with patient
not
safety.
How we do
so
it.
she feels horrible, and she's fired and shunned.
And there's a thing called second victim scenario, right? Where that happens to a person who's a good person who made a terrible mistake, and maybe there was negligence even, but it wasn't intentional. And the next thing you know, they're suicidal or something worse, right?
Yeah, I feel terrible.
And so she then she's charged with criminal negligence, homicide. And on top of that, she loses her nursing license. I don't know what their process was. They went for the board or whatever. And she admitted, she said, no, I was complacent. I made mistakes. There were systematic problems, but it was my fault. Yeah. I feel terrible. There's not a day that goes by I don't think about it. About 1 billion nurses reached out to me when I first did the story on this a couple years ago and said, dude, but by the grace of God, right? So many times
could have been me.
Have I come to that last point and something happened and I go, paralytic, oh my God, that was a close one. Because the systems are set up in many ways for us to fail, or it's a Swiss cheese model where
it's a
all
Swiss
the
cheese
holes
model,
align.
Yeah.
Right?
They changed the system. The machine wasn't working as well. They got comfortable with overriding because there were structural flaws in the system. They overrid. They had a trainee to supervise, so their attention is distracted. The
moral hazard of relying on safe systems, so you tend not to be as vigilant.
You're more complacent.
And that's a natural human behavior phenomena.
Absolutely.
It's been studied in radiology when they have AI check, then there's more mistakes that the AI picks up. So, I mean, the moral hazard is a real thing. But
and the marketing of the products is that it's going to make it safer. That's part of the marketing of some of these products and these machines that dispense these.
Epic will make medicine safer. By alert fatiguing us. And
and this computer that, like in the old days when you could just access any medicine by pulling on the drawer, it's different now. It's all locked up and it digitally unlocks just the drawer. I mean, I'm not an expert on it because I don't handle medicines that much myself.
And what RaDonda said was that that day they had to do like 30 different nurses had to do 30 overrides on the Pyxis system because of the whole Epic miscommunication disconnection thing. So this was already happening. There was this other thing, and so now she's being criminally charged.
Why are they charging her criminally?
I don't know.
Posturing. This is political posturing. It's
Nashville, so I don't know what's going on. But I'll say this: you've gone through COVID. You've thrown all the nurses and doctors under the bus. You give them a crappy system, crappy technology, and people get rich off your backs. And then they do this. Who's going to want to be a nurse?
After nurses jumped on the grenade, when we didn't know what the case fatality rate was in a population of healthcare workers.
And they were shunned in grocery stores because they wore scrubs coming from a hospital and people were panicked and treating them like crap.
And they couldn't interact with anybody when they came home because people were still believing in the fomite and surface transmission theory.
They were taking full body showers out in their yard and crazy stuff like that. And so we respond then by criminalizing what is an error, a major error.
But an inevitable, like when you talk about a denominator of hundreds of thousands of nurses, this thing, it's inevitable. And your point is well taken that it could have been anybody, who happened to have this series of events line up. She's not a malicious actor.
No.
She's not intentionally doing this.
Could have been me.
She's trying to do her best.
And the thing is, in a just culture model, how you would process this is you would first try to assume intention, like, okay, are they a psychopath? Are they crazy? Are they criminal?
Right.
Is there active neglect? Like, are they refusing to follow protocol, et cetera, et cetera, et cetera? And I don't think any of that did that here. And so she would be a candidate for serious education and rehabilitation, not for going to jail, even losing license. Now, this was bad, and I don't know all the subtle details as to why the prosecutor decided to do this, make an example of this. But I'll say, just on the surface.
Yeah, but I mean, I guess I'd say that, like, yes, there are some parts of this equation, it sounds like to me, that are under her control. But you can't just punish the person who that lined up with a series of systematic errors. You need to have some policy that addresses all of the people who make those kind of errors and rehabilitates them.
Yeah.
Rather than
or the system.
And of
or
course,
both.
Yes, both, right. The system needs to be rehabilitated. There's no excuse for a system where override is the default. If override is the default, then what the hell is the machine doing?
What's the machine doing?
It's wasting my time. It's really a problem. It's an impedance to doing proper work. So override should not be the default. And then the things that she did wrong, people should be, better rested and have less stress and be under less pressure. And
better support for teaching, better staffing, all the other things that you do. And then there's another systemic question: is like, why was vecuronium on a crash cart in radiology?
Yeah,
seems a little.
Do they need to paralyze
somebody?
in a hurry?
I guess you might, but seems a little.
There's
far-fetched.
a system solution there, right?
Yeah.
Because if you say,
take away paralytics,
this should be part of a crash cart, but not part of the Pyxis where somebody's drawing up Versed. Right. It's just if we start firing people and prosecuting them for near misses or things that, we all relate to something like that in our medical. If you
absolutely,
if you don't, you haven't been in medicine long enough.
Of course.
I mean, I certainly relate to having made very close near miss sort of mistakes. Yeah. And if we start firing people for that, we're not going to have anybody left.
Right. And we do it when we drive. We've done things when we drive sometimes where attention is distracted and you go through a red light or you do something stupid and you just go,
I got lucky.
I got lucky. But there's times when you're not lucky.
And if we fire people for near misses, who are we going to have left to fire for having natural immunity and don't want to get the fourth booster? Who will we have left to be fired for the fourth booster? We'll have no one left.
Tell me about this fourth booster, man.
I don't know.
What is going on here?
Like they say, I've always said it's a 4-dose vaccine.
It's just up to date now. It's not fourth because
right. You have to be up to date.
Yeah.
Okay. I got one thing to say right off the bat, which is that I was told that the virtue of the mRNA scaffold, the mRNA product, is that mRNA is so great because you can so easily swap out the part in the middle. Why are we even entertaining the idea of boosting with an ancestral strain that hadn't been around in 1.5 years, is no longer the dominant strain, and for which we know the vaccine effectiveness with time is in the toilet?
Yeah, 13% in young people against Omicron.
You're talking about symptomatic disease or hospitalization? I mean, with
symptomatic disease.
And with enough time, you're talking about maybe 16 weeks or 20 weeks post the booster. Yeah, I mean, I think I believe that very much because I've looked at so many of these studies with that kind of point estimate. I mean, I don't know what we're talking about. I mean, look, I know why Moderna wants to do it. And by the way, Moderna is pursuing a fourth dose in 18 and up, and Pfizer is pursuing a fourth dose in 65 and up. So Moderna, they're going for the gold. They want to get all that market share.
There's not even good clinical outcomes data to support the boost for the third dose. Or even maybe a second
there's some
dose.
There's some confounded observational data for a fourth dose. Do you like your data confounded or heavily confounded?
I only want to see titers. I don't want to see hospitalizations or severe illness or deaths. I only want to see titers.
Of course. No, that's the gold standard of medicine. You tell someone you draw a test and the patient doesn't feel anything, and then you tell them they're better off because you administered therapy. Right?
No, but then the museum needs to require that fourth dose for a child, or they have to get anally tested.
Well,
with
first
an
of all,
anal
the
swab.
museum should have designed this study because they're the experts here.
The Museum of Science.
It's a science museum.
It's
they have an eagle, my friend. What more do they have an eagle in there?
I don't know.
And the great irony
I couldn't go. I was planning to go. I had a gift certificate. Someone bought me.
I believe in mammograms, but I don't recommend them for men, right? Because the data does not show.
Some men,
right?
You know what?
There's no convincing data.
This is where you're off the equity and inclusion train 100%.
Well, I'm sure you could make an argument that we could save one life of a man with breast cancer if we
with 100,000 screenings.
Yeah, but there's maybe a cost to the radiation exposure to people. So in
Sounds like
children.
you're thinking about trade-offs, Marty. That's a forbidden word these days.
Did you study policy, perchance?
Are you professor of policy?
I'm not I consider Vinay an evidenceologist. I mean, basically from his hematology, oncology, analysis of the literature, he's basically a studyologist.
That's great.
That's what I consider as a meta-researcher, yeah.
That's
true.
That's why I love reading your stuff.
I wanted to be a foreskin expert and call myself a prepudontist. But anyways, back to you.
But they never fully accept him in the tribe. So
that's true. The urologists feel like I'm encroaching on their...
So here's the thing. We're applying policy to all children healthy and with a comorbid condition when we've never gotten the data on the subgroup analysis of each of the two groups. In the healthy children, we don't know if any healthy child has ever died. Now, there may be a couple, there may be 10 or 20.
We do have some nice data from Germany where they tracked, and they found that between 5 and 11, there were zero deaths.
No deaths in healthy.
In healthy kids in Germany.
Right.
So what was this data that I heard recently? They're saying like a third of the kids that died that they looked at a set in the U.S. were healthy kids with no comorbidity?
No, it was hospitalizations, I think.
Okay.
There was a hospitalization report. I think it was more like a quarter or 27% or something.
Okay.
But that's hospitalizations, and they're picking up incidental
correct.
Omicrons.
I want to also say that is this like, I guess, the first thing I think about when I hear about hospitalization is, are you talking about hospitalizations for COVID or with COVID?
No one will tell you.
And no one will tell. And maybe, honestly, they don't have
They don't know.
They don't have the methodology to know. I mean,
they don't want to know.
Well, I mean, they have difficulty giving an accurate count. I mean, no child should die of COVID, but at least we should be able to know the number. The fact that they're off by 20%, isn't this? I mean, look, isn't this surreal? They're off by 20% of a number in the 100 to 1,000 range. I mean, this is the ballpark of the number. They cannot count this statistic. What are they doing?
Look, I think vaccinating children probably makes sense, but the studies don't account for natural immunity, for which it's hard. How do you have the certainty to tell somebody with natural immunity you must get vaccinated, even though there's no studies on vaccinating kids who already have natural immunity, and there's no studies, there's no data on the risk of dying in a healthy child, and the only data we have from Germany says no healthy child 5 through 17 died. And by the way, that was over a 15-month period when they were not vaccinated, with rare exceptions.
No, they're unvaccinated. And also the prevalent strain at the time was Delta. But I guess to your point, I mean, there's a broad point about natural immunity, which is that whether you're young or old, if you've had COVID, first of all, you wanted to get vaccinated first. I mean, if you wanted to get vaccinated first as an adult, then get COVID, of course. But unfortunately, 140 million plus Americans have had COVID, at least 140 million. That's the CDC's estimate. It's probably a lot higher because that's a pre-Omicron estimate. Okay, so if you've had COVID and recovered from COVID, and then the question is, do you have an additional benefit by being vaccinated? And the answer is the perfect study would have been a randomized control trial just in that population. And Pfizer and Moderna have tons of cash. They can easily afford such a study. We don't have that study.
Why would they do a study to shrink their market size, right?
Yeah, no, you're right. It will only erode their market share.
And the study that we have from the CDC was a pretty good study. It was data from New York and California.
Okay, I like
Remember this
study, yes.
And it showed that if you look at what really matters, which is hospitalization, okay,
Yes.
the rate of hospitalization in those who had hybrid immunity, that is combined natural immunity from convalescent disease plus vaccination, was 0.3 per thousand. The rate of hospitalization in those with natural immunity alone was 0.3 per thousand.
Yes.
So you capped out.
And now the vaccine-only arm. Vaccine without natural immunity was good, but much higher. So natural immunity in that study.
Higher hospitalization.
Yes. Right. So the point is, I think the point you're making, Marty, which is a brilliant point, which is this, in this New York, California study, which somehow was published in MNWR, the first good thing they published in that journal.
That was very strange.
It's very strange, but
Got
it was
through
a good
the Ward
article.
Zero COVID peer review.
Yeah, and they still denied it.
Of course.
Their own conclusion in their own article was nothing to do with the
How
data.
to lie with facts, context.
It says that it reemphasizes the importance of vaccination after natural immunity. But if anything, it shows you that natural immunity is so profoundly good in preventing you from subsequent infection and rehospitalization, so profoundly good that you probably, from a policy standpoint, if you're a policymaker, those are the people you leave alone because you don't need to bother. They're not the policy problem. The policy problem is the old, unvaccinated, and non-immune person. Right. And there's still those people out there.
That's where we should be putting our energy.
They're the people who Hong Kong is, this is the Hong Kong effect.
This is the situation, right?
No, this is exactly right. Is that, look, the three of us have been criticized unfairly, I think, for somehow being
I've never received criticism.
You know what?
Life,
I'm I've
criticism in
finally
me.
made a mistake myself.
He doesn't read.
You're right. I haven't either. I misspoke. For somehow being anti-children by raising the question about natural immunity in kids and deaths in kids and with COVID, without COVID, et cetera. But the truth is, what we care about is the area under the curve of people surviving. Right? So why are we spending...
And having minimal complications.
Minimal complications.
Yeah,
So,
and vaccine-related complications, where's that data?
Yeah.
We don't know
myocarditis,
it.
et cetera. And let's say it's zero. Would you still compel children... you could argue, well, no children should die, so then there's zero complications from vaccine. Let's give it to everybody. But there isn't. Not only are there some rare complications, but there is the cost and there's the distraction of resources.
Yes, and to that point, we have seen in recent statistics a huge drop in routine childhood immunization, including MMWR.
Exactly.
And then the next point, to your point, is that we are all advocates for vaccinating children safely, the optimum risk-benefit balance. And so I think to Marty's point, if a 4-year-old has had and recovered from COVID, are they going to need to leap with this Moderna data for 25 micrograms times 2? I'd say question mark.
But it's the absolutism that is hurting.
Yeah, that's what
right?
it is.
It's the absolutism and the certainty of.
But I'll tell you why there's absolutism. Yeah. Okay, here's my this is I think there's a few forces. One.
Am I gonna have to edit this?
For a separate show.
Yeah, exactly.
Make a note of the time. So you have to delete it. Okay, no.
Timestamp.
So here's the absolutism, and it's going to hurt a little bit. But I think one, the White House is running the policy on COVID. They've run it so hard that they've got resignations from FDA because they've taken control. A politician should never be running public health policy because politicians' horizons and goals are very different than public health goals. Politicians' goal is on this November election, and politicians need these cases to be low. And if that means boosting 12-year-olds just to get the numbers down, you might have to do it. You know what I mean? Their incentive is not optimal public health. It's on making sure their political fortunes are good going into election. That's one problem. I mean, I'm not saying that they're terrible. They're not terrible. They're also not the worst. It could be worse. You could have totally incompetent people. Then they've hired people at these agencies who are nice people, good people. I'm sure they've done good work, but they have not been steeped in a policy culture. You have a head of a CDC who is an academic ID doctor who's run a small
doctor who's taking orders from the White House probably.
And I'm sure under the thumb of the White House, if she does the wrong thing, the White House can push her out. And they got close. They started leaking to news outlets all this kind of trash about her, trying to getting ready to show her that they could push her out if they wanted. And also, she's not a policy person. No offense to her. She has expertise in her field, but she's not played in the sandbox of public policy, which is a very complex game. You and I have spent a lot more time in this space, and we understand that there are real trade-offs. And if you only have so much political capital, you can't blow it on trying to boost a 12-year-old when you need to spend it on boosting an 85-year-old. And then the last piece of the puzzle, okay, I got to tell it.
I'm getting sweaty.
They are picking people. They're picking people, including their new czar, because they're on social media. Yeah, and look, I have nothing against Ashish, but let's just say this. If Ashish, who his background is not ID, epidemiology, his background is different, but the reason he is picked, whether we like it or not, he tweeted a lot in the early part of the pandemic. Those tweets got the attention of reporters. They put him on TV a lot. He's good on TV. He's neutral. He's balanced. He's always a middle of the road guy. He blows whichever way the wind is blowing, and that got him the attention of the White House. He praised every one of their policies, even their boneheaded policy to use vaccine passports for domestic airline travel, which even they walked back because they realized it was so boneheaded. He praised it. He praised every decision they've ever made.
Natural immunity.
He ignored. Yep. He was for school closure. Thank God he's better than others because he apologized.
He apologized. I respect that.
I respect that because some of these other people, they still haven't apologized, and I will get that apology from them in the next few years. They will give it. I know they will. They will want to give it. But these are the problems. You got people who aren't policy experts. They're under the thumb of a politician, not a public health expert. And you got some people who are kind of self-made media stars. Good for them. Hats off to them. But those aren't the people who you got to go to. And
to be politically fair, that's how Scott Atlas got his job. He was on Fox News, and Trump saw him on Fox News. So, I mean, it seems like we're picking, when politicians pick science experts, it's not always for the science.
The thing to me, though, is you've got a medical establishment that is basically in lockstep, and they have locked arms and walked off the cliff together on so many issues, right? On so many issues: surface transmission, school closures, the interval,
masking toddlers,
ignoring natural immunity, hospital visitation. You go down the list, right? And where's the humility? Where is we don't have great data on healthy children and the vaccine complications. So we think there may be a benefit to vaccinating healthy children, but when they have natural immunity,
we don't know for sure.
We don't know for sure.
And we're not going to mandate it, but it can still be a choice. That's the right answer.
The way to do it.
It should be like, we're not going to say advocate against it. We're not going to advocate for it. We're not going to mandate. We're just going to offer it. Here are the data. Here's what we're learning. Here's the real-time data. By the way, our website's up to date, which they could work on that. But to your point, Marty, I got to say this, that those people locking arms in arm, they're not as many of them as they would like. They have taken control over some institutions like AAP and CDC. They're very vocal on social media, but they are not the majority of actual practicing infectious disease doctors. You and I talk to doctors all the time.
And I do too. That's why I always say it's a silent majority of people who are sane.
Yes, who are sane.
Who are not ideologues, who are looking at like, okay, what are the ins and outs of this? But they're scared to say anything. So it's funny. They'll message us. Oh, I heard you guys are doing a show. Can you say this and this and this and this and this and this?
Yeah.
The things that we all believe, but like if I say it, I get fired or I don't get promoted or I get somehow blackballed. And it's absolutely
I've had like pediatric infectious disease experts. They like email me and they're like, people say there are 0 downsides to masking a 2-year-old. Can you point out that is obviously on the face of it ludicrous?
Oh, yeah.
Of course, it's obviously on the face of it a ludicrous proposition. Yeah. There must be some downside.
Listen to these doctors and speech pathologists and high school guidance counselors. I mean, there's a private school in this area where my friend was saying that the majority of kids in the school is, I think, about 11-year-old aged students, a majority engaged in so-called cutting.
Yeah, self-harm.
Self-harm.
Yeah.
Majority of students, that is a major flag.
I'm surprised not 100% in this area. Like when I moved back here, I felt it. You feel it energetically. Like there is a kind of insanity of how we're treating kids in school and the expectations and I think the COVID thing has made it even worse. So my kid was going to have a play date, right? My youngest.
At the museum.
At the museum. Just tears. Daddy, what do you mean?
Yeah. Daddy, they have a poster of you there now.
Do not allow entrance to him.
Throwing darts at it, Daddy.
I'll send a tweet so they change their policy on their website before she gets there.
It just says no demonias.
No demonias allowed of any kind. I'm like, there's like at least 3 more demonias in the world. But they're going to have a play date. 3 kids wanted to come to our house. One kid's parents said, every person in the house and every child must be masked at all times. And my wife, who's not normally like this, was like, well, then that child can burn in hell. Basically, no one comes to our house and tells us what. But the thing is, what kind of conditioning have we made that the safetyism is such that at a play date where the school doesn't require masks?
I mean, this is the kids have suffered so much horror. And it's adult anxiety. It's an adult. I mean, I hate to, it's almost a mental illness in adults. The risk they have blown out of proportion the risk to children. They don't realize that there are risks for depriving an adolescent, particularly of these ages, really incredibly important developmental ages for relationships with the opposite sex, with people romantic interests, perhaps even the same sex, for maturing in terms of your sexuality, your growth.
Smiles are contagious.
Your social, your friends, all these things are so vital in this age group, and we've deprived them of all this for a risk that is orders of magnitude lower than risks of.
We don't even know if any healthy child has ever died of COVID, right? I mean, it may be a couple or 10 or 20 or
global
50.
IFR data would probably put it at 3 to 4 per 100,000. I'm talking about the Lancet paper that came out. And look, I know there's some limitations to that. So to your point, because it really doesn't separate comorbidity from
that's
healthy
non-obese.
But let's just say the raw number. I mean that they're giving 5 to 11. I read it. I think it's about 3 to 4 per 100,000 global IFR. That's low. You know, I mean, kids take risks when they ride on a motorcycle, ride on a bicycle,
swim in a pool, much higher risk. Than
higher risk. Go on long travel, ride with a 16-year-old driver late at night. Particularly a male 16-year-old driver when they're, that's a very high risk. I mean, that's a high risk situation. You cannot bubble wrap someone growing up in this world. You're not doing them any favors. You're actually weakening them for the challenges of life, which are often
extensive
and
require a certain antifragility.
Yes, and antifragility. Yeah, a certain resilience. I mean, what about? This is kind of off this, but I know we all agree on this, which is I am always impressed when I meet someone these days who tell me that that their goal is to make themselves better at something, to really master something, they're willing to work hard to do it. Those are like important traits, and to overcome adversity. These are really important traits.
So again, to
throw your hands up.
To cite Daniel Schmachtenberger, we talked on our show about this concept of hormesis, which is stressing a system and the system becomes stronger from the stress. That's antifragility, hormesis. So exercise is like that. It sucks when you're doing it. You're punishing yourself through it and you come out better for it. Or some kinds of even spiritual type ordeals, like the old sweat lodges and stuff where you suffer through this like 120 degree heat and you come out just like awake. Yeah. Like that kind of thing where you don't break somebody, it's within the tolerances. That's children need that. Adults could use a little of that. But we've generated this like very fragile generation. And I think the masking thing is another nail in that coffin.
Yes, and it's a constant visual reminder of one very low probability risk for the child.
Yes.
Ignoring all the other higher probability risks. I feel bad for this poor kid whose parents say, you can only go over to that house if you all mask. And by the way, are they not allowed to drink water? What are they going to do if they drink water?
So the heartbreaking part about this is then, so we tell our daughter, we're like, well, you're going to have to tell her that there's going to be people in the house, like the parents and stuff, and the sister that's not masked. If the kids want to mask, that's fine, but there's going to be unmasked people. So my little daughter has to tell this girl that, and she's got to go to her parents. The parents are going to be like, well, then you can't go, and there's going to be all this drama. Over what? Over a total misapprehension. Triple vaccinated. No, not the kids. They're double vaccinated.
They're at least double vaccinated.
They're double vaccinated. Yeah.
I mean, who thought we would be having this conversation 1 year after a mass vaccination campaign? Yeah. Will we be having it 5 years from now or 10 years from now?
We're going to have it in the fall for sure. Because we're going to see
cases are going to. I know
cases are definitely going to.
Already the sewers are blowing up with COVID.
I mean, that's where I look. Every morning I'm in there with the effluent.
You know what? It's a log-fold increase in the logs. You know what I'm saying?
In the logs.
What's the p-value?
But I did
see what I did there.
The p-value. It's significant. I saw somebody tweet a thread about how you can wear an N95 and actually drink a full bottle of water. And the thread involved deep breaths through the N95, holding your glottis in place, pulling the N95 down, drinking, then putting the mask on, and exhaling briskly to get the air out, and then to repeat this. And with 3 or 4 good draws through an N95, you're capable of drinking a bottle of water.
I've got that beat. I just got a trach.
And a G-tube.
And now I'm totally safe. Like nothing can hurt me except for opportunistic infection and stoma breakdown.
It's just like the Palo Alto Stanford students. These are smart individuals. Yeah. 47% wearing
But you saw this David Leonhardt article where he looked at like attitudes to COVID by political party.
Yeah.
And the reason I think we've lost the colleges, like, I've always wondered, like, I was like, I've always wondered about these college students in a number of ways. One, this is a tangential, but one, I do wonder when these days I always see that there's like some controversial speaker on a campus, and it's usually different ranges of controversy, from non-controversial to actually controversial, and the students are always up in arms. And I think back when I was a college student, I was like, Marty, maybe I was just like a bad student, but I don't know a single person who spoke on. Like I don't know anyone who came on that campus.
I was like, people spoke at Berkeley when I was there?
I was just thinking about the next weekend and the basketball game. I was like, all right, I didn't have time to be protesting. So that's
I had tests to study for.
They lean extremely politically left, and politically left people have disproportionate fear of COVID, even after 3 vaccines. And I think the reality that people have to accept, I don't know, it's going to hurt, is that no matter how many boosters you get in your arm, you will get COVID eventually. You'll have a breakthrough. Yeah. You're going to be okay.
You're going to be okay?
You're going to be okay. You're healthy. You're young. You'll be okay.
Yeah, you're healthy. It's not zero. Yeah.
It's not zero, but if you're older and had comorbidities, then, there's a risk. Yeah. But the choice is, what are you going to do? Hide out forever?
And just to clarify, I wasn't suggesting that the total death count in healthy children worldwide is 0. I'm trying to suggest that we don't even have this data.
We don't have the data, right.
And so how can we be so certain?
Well, they have counting problems. They have counting problems.
There's a significant math problem.
You know what? I know who the new COVID czar is. The Count from Sesame Street. Could you imagine? How much COVID is in the sewer? 1 log filled with COVID.
I saw that. They misrepresented the wastewater data. Did you see that?
Did they?
Wow. Yeah. They mispresented the wastewater data on the CDC website.
Accidentally?
It was probably, a lot of this stuff is just...
It's new to the wastewater data. They're still figuring it out.
To be fair, it was shitty data.
Hey, It may be shit to you, but it's bread and butter to me. We say that in colorectal surgery.
Of course.
They also withheld data. Remember, there's a New York Times story by Apoorva Mandvi about how the CDC...
Shocking, she wrote it. I
Yes,
saw
I know,
that.
I
Yeah,
know.
they're not showing the hospitalization data in people under 50 who are boosted.
Yes, of course. But here's the thing: why is the agency that's proven themselves incompetent at data analysis not sharing the data for others competent people
They
to
don't
analyze?
want, because obviously it doesn't support the narrative, right? Because other data is telling us
And
that
she's the New York Times reporter of Lord Zero COVID. She's been on that Lord Zero COVID beat for a long time
she's
now.
been driving me crazy.
She might as well padlock the doors of the schools herself with the way she wrote those news stories in the spring.
Dangling fear and sourcing the same doctors and taking whatever
The same doctor
government
from Twitter.
from Twitter.
Of course,
and
that's where you got to find the fear.
It was
the
like
fearful.
weapons of mass destruction in Iraq.
It is. It's
Government
gonna look like
fed
that.
them stuff, and they were, thank you so much, and they just parroted whatever the government
He's
fed
so
them.
right with that analogy because I think like it's going to age like weapons of mass destruction. People are going to go back and pull those New York Times stories where they like cover some family scared of going to school and like the huge amount of societal damage that story did.
Yeah.
It's going to look like the WMD stories, I think.
And again, it goes back to this like how to lie with facts.
Yes, how to lie with facts.
You can cherry pick your own data.
Yeah.
Like if CDC is like, well, you know what, that data, we did that, but
Yeah, they did not list hospitalization rates in boosted Americans under 50, but they listed it for people over 50. Did they only collect data in people over 50? No. All that data gets channeled into them for all age groups. So something fishy is happening. Now, in the group 50 to 65, the difference in hospitalizations among those boosted and unboosted, that is just had the primary vaccine series, was the difference between 4 and 1 per million. Who were those three people? Probably immunosuppressed. We know immunosuppression is roughly 3% of the population of adults. And so that's probably accounts for that tiny difference. And that was in people 50 to 65. And yet the emphatic nature by which we have this absolutism, right, that you, even if you've had COVID, you have to get a booster. That's dishonest. People are seeing through it. People feel that they've been lied to for 2 years, and in some cases they're right. Did you hear that the elites, the people that are making all the decisions, Collins and Fauci, they had basically like a straw poll of a couple of their friends that they summoned.
You heard that on his show. That was from his show. He had Offit. It
was Offit.
Yeah.
Oh, I knew about it before. But
you knew about it before?
Yeah, but I was
Marty's a political insider.
I swore that I wouldn't tell anyone because of the source.
Yeah.
And so now it's basically out there,
Yeah, it's
right?
out
They
there.
did the
It's out
straw
there.
poll. You're
Yeah.
putting a massive decision like that in front of
Like 5 people.
who are, let's be honest, they're politically loyal
Yeah, of course.
scientists.
Otherwise,
right?
they wouldn't be on the committee.
Otherwise, they wouldn't be on the
But that's a
committee.
huge problem because, like,
Did they invite you to be on the committee?
I'm not politically loyal because I'm a data first person. Yeah. But you know, Marty,
You don't just sign up for the program 100% of whatever one party believes.
no, because I'm
You
not.
think for yourself?
Yeah, I'm not.
Oh my gosh.
Crazy person.
I don't know what to do with
Who
you.
am I?
Are
Get
you
off
one of
my
us or one of them?
But you know, Marty, I think
Come join
that,
the
like,
alt middle party.
if you were really
we
running
should
the
start
show,
that.
they should want to have like a red team, a team that opposes them.
Yes.
They
Well,
should
that's
have a
the key.
bunch of scientists who disagree with them come to these meetings and be like, look, if we're so confident that our proclamations are right, let's get, Marty, let's get VP, let's get ZD, let's get all these people who like disagree with us to push us.
Yeah.
And that's what good companies do. Good companies always have red teams pushing back.
That was
And they're
Obama's.
steel manning those arguments. Yeah.
Remember Obama's team of rivals
Yeah.
concept? Remember that was there's value to that, right?
Yeah.
And especially when it comes to science. I mean,
It's now it's team of people who praise me on Twitter. That's what it is. Team of people who praise me.
Yeah. The third way to lie with data on fact checking stuff is emotional framing. So if you take a study and you're like, this is like you frame it up front like groundbreaking data out of New York. The vaccine is crushing it in little kids, and then it's like 13% efficacy after.
Yeah.
I'm going to fact check that by asking my friend on Twitter.
By my friend, and the friend praised him so hard on Twitter, they were one day ahead of the wastewater data. They're one day ahead of their wastewater. They're even better than the wastewater
Did I
data.
tell you
they
ever-
praise him so good.
Did I ever tell you about this thing that was going around in some DC circles of federal contractors? I have a friend who's close to this around aircraft carriers. So how many aircraft carriers does the United States have?
650?
11.
Oh.
And the country,
If the price is right, I would have won.
Wisdom of
You
crowds.
overbid.
the country that has the next most, there's 2 that have 2. and that's the UK and China. So
yeah.
we have 11, and it's always a subject of debate on Capitol Hill when it comes to the federal appropriations for the military. Is do we need all 11? Right, that's a topic that gets kicked around a lot.
Right,
and so we have 11. One is always in repair or being serviced. And one is always under construction, and it takes about like 10 years to build one of these aircraft carriers. They're all nuclear powered.
Oh.
So the company that there's one company that makes it, okay? And the name is Huntington Ingalls. And they're publicly traded, and they're a big company, and they're probably going to, their media relations is going to have a heart attack when they see this. But they basically have all these welders and yard workers that are working on the aircraft carrier, and their vaccination rates were low, and they encouraged vaccination. But if they had to fire as a federal contractor people who are not vaccinated, you would fire half the workforce or something like that. So they basically told the federal government when the White House called, you want us to fire workers who are not vaccinated? Go pound sand. We're not going to do it. Wow. If you want to find yourself another company to build your and service your aircraft
monopoly
carriers,
power,
go ahead.
Yeah. Wow.
But, it's halfway built in the bay, Wow. So the White House couldn't do anything. But then all the other federal workers, and I'm not, endorsing, I'm just describing what happened. I'm not supporting what Huntington Ingalls did. But they said, go pound sand. We're not going to do this. All the other federal contractors started losing workers because when they announced or heard about the federal vaccine mandate, the workers said, we're going to go to Huntington Ingalls, who basically are pretty openly saying, we're not going to enforce this. And so then all the other federal contractors were like, we're not going to enforce this either, but we have to say that we're going to do this. So basically the whole thing was a farce, right?
Wow.
Really nobody enforced this. The few
these
places.
mandates, this is another thing.
It hardened people.
Ashish Jha got wrong, which was, I think, if you look at, sometimes they judge the mandate, like if you look at vaccination over time, it's going up, 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 up. Then they drop the mandate and it goes up, up, up. And then they say anybody who got vaccinated after the mandate was because of the mandate.
Yeah.
Post hoc ergo propter hoc, which is a fallacy because a lot of those people are going to get vaccinated anyway. It's what happened to the change. And if you really look at it, I think it's hard to believe it did more than a very few percentage point change. It targeted 18 to 40, 18 to 50, 18 to 60, not 65 and up where you needed to focus.
You're right. That's right.
And then the political anger backlash from this mandate, it's not worth it.
It created never vaxxers.
It created
never vaxxers.
It created
never
them.
vaxxers.
And it empowered idiots like Malone and McCullough who are out there spouting insane talk, and it empowered them. They're like the Nazgul. They're like, because the government is idiotic.
You always empower people who are wrong when you have a credibility vacuum and when you overplay your hand.
Yeah.
And there's only so much political capital you have, and it was misused, I think.
And just one last. Marty's got something. Marty's got
something juicy. Go ahead.
Oh,
Go
okay.
ahead,
Well, I'll
please.
give you something on juicy. Just to go back to Hong Kong.
Oh, yes.
Hong Kong has the highest death rate in the world from Omicron BA2, the squeakquel, and the reason is their 70 and overs are vaccine hesitant.
Yeah.
Beyond vaccine hesitant. Only 37% of them are vaccinated. They had Lord Zero COVID they were worshiping for however long, 2 years. They kept the cases low. But then when the shit hit the fan, the most vulnerable people were not vaccinated. That is a a terrible cautionary tale of who you should focus your resources
on.
And how you can get it wrong. And they did. And now they have bodies piling up and the morgues overflowing and their healthcare system overwhelmed because they did the wrong thing. Well, we just got lucky that didn't happen to us with all the misappropriated resources to boosting a 12-year-old so they can go to a museum.
And boosting a 20-year-old so that they can attend Princeton University. A place of knowledge.
And all of the sort of education, health disparities experts who are sitting this one out, they're just sitting out the pandemic. They can watch Princeton University, which I think 1% of their graduate students are African American, in a community where there's a significant African American population. And Princeton, during the testing shortage, where it was, remember, a few months ago, very hard to get testing, the students are getting tested routinely twice a week. And
they're sucking up all the tests.
Sucking up all the tests from people in the population, many of whom are vulnerable and disproportionately represented in the majority individuals getting tested in the Princeton community they're not representative of the United States or the local community. So they're sucking up all the tests. This is a massive disparity, a socioeconomic and racial disparity. And all of these experts in this topic, and there's a lot of them, just sat this out.
Well, they sat out school closure, which was the greatest failure equity issue in their quarter century. But so now they're sitting another one out. This whole asymptomatic testing of young, healthy, vaccinated people, it's the dumbest thing. Are you you Scandinavian countries are laughing at us. They've all stopped this. They realize that these are scarce tests. You need to test people when they present to healthcare systems who are hospitalized. You need to test people. You could test people around nursing homes where they're vulnerable, but testing asymptomatic college kids is the dumbest policy on earth.
Stanford just stopped their weekly testing of all staff.
It's COVID zero. It's
Lord COVID, Lord
Corona.
Pray
on the lowest risk population on planet Earth, which are college students.
And right next to the Lord Corona idol is a Fauci doll.
With a bunch of vaccine needles stuck in it. It's like a voodoo doll.
You have to put in your Twitter bio Ukrainian flag and then 3 vaccine needles if you want to prove you're a good person.
Yeah, exactly.
You could only put 2, and then you have to have a Cal Academy taking a shit on you.
Yeah, that's my special icon.
2 in a Cal.
I'm the only person in history to ever be banned from the California Academy of Sciences.
But
for ideological disagreement.
Their booster policy, here's the booster policy. Once you get boosted, immediately the day after you can go. Because it works immediately.
The day after the immune response.
It's a brisk immune response.
Yeah,
a real brisk.
But if you're not boosted, you have to be tested that day.
Yeah, of course.
And so it's like,
But if you only had 1 dose, then you can't go at all. Because obviously then the test doesn't work anymore.
Even if you had Omicron twice.
Yes, no, of course. A Delta and Omicron.
Omicron.
No, you're not acceptable. You're unpure. You're impure. Your thoughts are impure.
Your thoughts are impure.
Yeah.
It's a thought crime.
It's a thought crime.
It's a thought. You cannot believe that. It's a thought crime.
And you know what? If you're thinking about not getting the 4th dose, you're not welcome. You got to commit. You have to commit to the 4th dose. No, who knows?
Now they have brain scan. They're working on brain scanning technology that can read your mind. You walk through a scanner and it's like, are you really thinking the 4th dose is not a good idea? Get out of here.
Well, it's like
impure.
Borla only made $24 million last year in bonus payments.
Billion.
Million. Borla.
Borla himself.
The company made I think $30 billion. Okay. But Borla himself got 24. So by the way,
that's it.
I know, right? But I'm a little bit.
You're going to need to take a few more boosters if you know what's good.
Yeah, I'm going to get boosted every Monday morning for the shareholders' sake.
For the shareholders meeting.
Yeah, I'm just trying to get to 1B. I have very modest
1B,
financial goals.
You want the card with the doors that go like this?
Very modest financial goals.
I actually started an IV mRNA infusion. So it's like a constant.
Why have the gap? It's it's a bolus. You need a continual
booster.
rip. Yeah.
That's for losers.
Yeah, no.
This is a constant immunogenic.
He keeps the pump on his hip.
Yeah, I do.
Constantly.
And if you see me just suddenly break out into urticaria.
But you're not allowed to change the construct. You got to go with the ancestral strain.
The ancestral strain. You change the concept.
The virus mutates, but the medicine is the same.
Medicine's got to be the same.
It's got to be the same medicine.
So in Washington State, they had this vaccine mandate for state workers, but it didn't apply to city workers. Okay. So the snowstorm hit in January, and the city workers, state workers who drive the snowplows, a lot of them lost their job because they were not vaccinated. They're driving a snowplow truck by themselves.
Non-essential job,
right?
Yeah.
No, a job that's a super spreader risk.
Yeah,
right. No, you're out there alone in a snowy road.
Right.
Who knows who may come
there
in
are
your cabin.
deer.
Oh, well, they all have them.
And
deer
they've got natural immunity now.
That's
deer.
true.
Yeah.
Deer.
We're trying to get to deer 0. I was talking about this with Vinay.
They still need 4 doses after they have,
they're unboosted deer.
They're unboosted deer, yeah.
Yeah, be careful.
Okay,
I saw an unboosted
these
bear once, and it
drivers
scared the crap out of me. Okay.
I understand most of the deer are dying with COVID, though, not of it. So, it's probably okay.
The CDC's keeping count.
The veterinary CDC, the VCDC.
The VCDC?
The VCDC, yeah.
That should be a thing.
Yeah.
Yeah.
That'd be a good job.
They deal with pangolin from China that are bringing in
Whoever
SARS-3.
wants to run the VCDC, just put a few tweets out there. They'll pick you soon.
Really love what Joe Biden's doing about pangolin.
So you're saying these snow truck drivers or what?
By the way, you guys are weak on COVID. I believe bear and deer should be tested twice a week, asymptomatic.
And you hold them down.
You go ahead and grab that bear. Hey, Smokey, come over here. Listen, only you can prevent COVID.
So the snowstorm hit, and they didn't have any. They didn't have enough snowplow truck drivers.
Sure, because of the mandate.
So the main interstate that goes through this small town called Kinnitus was basically unplowed and it was paralyzed,
Wow.
So the city workers said, well, we'll just plow it. We use that interstate. And the state said, no, you are not allowed to plow it because you do not comply with the vaccine mandate.
Oh my gosh.
And then they had a
car accident.
Well, they had a similar mandate for healthcare workers. Now, I personally feel like if you want to have an immunity requirement for patient-facing healthcare workers,
that makes sense.
it makes sense. But let's
Okay.
make it an immunity requirement.
So you
let's
can
not
test with
say
antibodies and you're good.
Yeah,
Right.
I mean, if
Okay.
you-
I like that. I
you
like
could
that,
have-
Marty.
I
That's a
mean,
compromise.
Well, it's ironic because now that the data has come out, and I just wrote this piece in the Wall Street Journal a few weeks ago, and the data now on natural immunity is that it was 2.8 times more effective in preventing hospitalizations during Delta than vaccinated immunity. Okay, and that was natural immunity from any point. So a lot of that was longer immunity than the more recent vaccine immunity, which, as you know, gives you this sort of antibody sugar high for a little bit that gives you a little more protection that wanes over time. But so even with that bias of comparing it with more recent vaccinations than long-term natural immunity was still almost 3 times more protective against hospitalization. Now, neither is perfect, but when we fired those with natural immunity for not having the vaccine, we fired those least likely to spread the infection at the workplace,
total
right?
virtue signaling. Yeah.
So multi-care, which is also in Washington State, and I put this in the Wall Street Journal piece, I think it was titled, "The High Cost of Disparaging Natural Immunity." And multi-care, which is this hospital system that has at least 8 hospitals, Olympus, throughout Washington State. And so they had to comply with this vaccine mandate. So they fired all these nurses. 55 total people were fired. And then probably about, I hear, 200 people quit in the days leading up to this hard deadline. So they lost about 250 healthcare workers, okay, with the mandate. Now, most had natural immunity. They've been around COVID a lot, the patient-facing staff. So then Omicron hits weeks later, and they have a lot of patients coming in, more work, and staff are calling out with COVID. They're testing positive. So they're basically in like battlefield war conditions. Yeah. And so the hospital tells people who are sick with COVID,
come in,
even though you have COVID, even if you have symptoms, as long as the symptom's not fever.
Yes.
And we need you to work. And then they send a memo to the managers in the hospital saying, please, the COVID positive staff that are coming into work right now, please try to assign them to the COVID patients or at whatever expense.
Make sure you match Delta, Omicron. No, that's not. But you know what I think you're pointing out, Marty? This, oh my God, what a story. It's so stupid. It makes my head hurt.
Great.
Whenever I talk to people who are like supporters of, we should fire the healthcare worker who had COVID and recovered if they don't want to get vaccinated, they say things like, look, if they're not willing to do it to benefit their patients, we don't want them there. They need to be, if you're really committed in this field, you're willing to do it. They use sort of moralistic terms. And I was like, moralistic terms will lead you astray often in policy. Policy is about having some sense. Yeah. And the sense is the facts on the ground are they've had COVID, recovered. Their likelihood of being rehospitalized with COVID is much less than somebody who just had a vaccine. They are very likely to endure a re-exposure. They may not even get sick. If they do get sick, it's going to be milder. And we're all going to get COVID many times in our lives. We can ostracize these people. We'll just get animosity. We might find ourselves in a pinch and we wish we had them. And we might have to do stupid things like have people actively with COVID come to work because we kicked out too many people.
Really stupid.
So stupid. But a policy person will see all these things and then think, on balance, in a perfect world, everyone will do everything we always tell them. It's not a perfect world. We have to make our bed and lie in it. And best thing to do is to keep people who've had COVID and recovered. They don't want to get vaccinated. That's okay. If they get 1 dose, that's great. If they get 2 doses, that's fine too. Let's just be a little more flexible, a little bit. But we're not in that world.
And come to rural America.
Yeah, I know. Go out, get out of your Twitter bubble.
Yeah.
But the other things, and then all the people commenting are people who are like, these armchair Twitter experts, and they're in their social media zone, surrounded by political friends who are not representative of average America. Bi-coastal elite.
I'm bi-coastal if you consider the Mississippi River one of the coasts.
You're just not elite.
Just not elite.
Dylan, why is my Uber Eats late? Let me tweet at Uber Eats. Why are you late?
Where's my Instacart delivery of fresh Honeycrisp organic apples?
Do you guys get this
They don't want to go back to the office. I mean, that's the new thing now. We're 1 year after. They're like, it's only been a year that I've been vaccinated.
Yeah, I don't want to go back.
I don't go back.
Do you get this thing where you show up to a restaurant and if I'm not wearing like a tuxedo when I come to a restaurant, they immediately go, DoorDash? I'm here to eat.
I have
sit
noticed
down.
that.
Do you get that?
It's because we're brown.
Well,
Yeah.
I don't know.
Wear the
I don't
driver's
see
cap
race.
when he goes.
So what's interesting though, the thing about
DoorDash.
the Twitter armchair people, for some reason, Twitter. I hate Twitter. You guys know this. This is a fact. I hate it.
Can I see your boarding pass? Is the other one.
Oh yeah.
Can I see your boarding
You're
pass?
sitting in first class. Can I see your boarding pass? All right, sorry.
It doesn't help that you're ululating in the seat,
I get that a lot. They're like, the machine has randomly selected you for. I just got it recently. Machine has randomly selected you for screening, and it really randomly selects me if I haven't shaved in a few days.
That's right.
How does it randomly know that?
Yeah.
I need like Vin Diesel's fake ID, so I can just go, look, I'm a celebrity. I'm Vin Diesel. Like, you don't really want to.
Like, you watch Fast and the Furious 24,
right? That was me.
25.
Yeah. That Twitter has this kind of cachet that the press cites what people say on Twitter.
They do whole news stories about
on some rando on Twitter attacked such and such. Well, blasted on Twitter was Ashish Job by.
No, they did by Waleed, because in the New York Times story about Ashish, they did. It actually
that's
said
news.
No, it said in the New York Times story. It said Waleed Jalad tweeted people who immediately retweet what the president, or people who do op-eds 2 minutes after the president made an announcement, are not impartial experts. His tweet is in the New York Times story. This is like the new journalism. It's like you open your feed, you find what people are saying, and you're like, oh, Z-Dog getting slammed over beef.
Kerfluffle.
Museum kerfluffle. Renegade comic. YouTuber. What is it called?
Controversial.
Z-Dog NB.
That's
contrarian physician.
Right.
Blasted over battle with esteemed children's museum.
That's a weaponized
That's emotional
term.
framing.
I mean, that term is weaponized,
It
controversial.
really
I mean, what was
controversial.
Albert Einstein?
Yeah.
Was he mainstream
He's
establishment
some asshole.
scientific?
Didn't agree with Newton.
Ignaz Semmelweis. I mean, we could talk about him for hours. Washing the hands. He was a renegade. That guy. I don't know what kind of accent that is, but it wasn't a Semmelweis.
It was, I think, an Austrian.
Austrian,
maybe.
A model for neutrality. For
Is that what you
Ukraine,
use
perhaps.
when the TSA's checking you out to
I
see
do.
if they want to?
I do. I go, no, I'm totally white. would the brown person talk like this? No.
And by the way, you've set up your lighting discriminatory against me with darker
totally
skin.
true.
Yeah,
It's totally true.
washed out.
Because we're
I'm all
both on the same
washed
side.
out.
I'm not designed for this. I'm like, Vinay, you're going to have to sit forward because you need more light.
So I can't wait till we actually can start talking about healthcare again, because
what?
it was a mess before we started. And it's like we forgot about it. We forgot about all of our issues. We forgot about all these issues in oncology, about drug pricing, about the cost of healthcare. So this just came out. Kaiser Family Foundation. The cost of health insurance in the United States in 2022 is $22,000, $221.
Really?
I think that's roughly what we're spending for our family.
Is that right?
Yeah.
And this myth that we've got to get rid of that, I'm not paying, my employer's paying.
Right.
No, it's stagnating your wages.
stagnating
It
your
comes
wages.
out of the pool
It
of
comes
money
out
of
of your
wages and
your
benefits.
wages, and that's why, like, so many of these societal problems where people are more and more polarized and angry with each other and all these things, it comes from the fact that, like, you're living a worse life than your parents did at your age in every metric: home ownership, marriage, children,
Life expectancy.
Life expectancy is down for
down.
4 years in a row. You can only blame COVID for some of it. You got to blame Purdue Pharmaceuticals for the rest.
That's
of it.
true. The Sacklers.
They're doing fine. So you may be interested in this. This came out 2 days before I gave that presidential address at the Gyn Onc conference. A study from the American Cancer Society that half of cancer patients and survivors are in debt from their cancer care in the United States. Now, the breakdown was even more interesting. 73% said they worried about the cost of care during their cancer care. They got other stuff to worry about.
Right.
And I'm sure that stress, that cortisol, really helps the cancer
seriously.
to shrink.
I mean, we take people who have one medical condition and we give them 3 more.
Yeah.
They come into the
Financial
hospital.
ulcers.
We give them financial toxicity and stress,
Yep.
which we know is associated with everything, including your immune response. And then we give them malnutrition because they're often on NPO, as we may want to get a biopsy and you're on a wait list.
A wallet biopsy.
And we're feeding them total dog food in the hospital.
Yep. And then we wonder why their sugars are high and they've never had diabetes. Right.
Yeah, right.
Yeah.
And then we give them sleep deprivation.
Yep.
Right?
By checking their vitals Q1 hour.
Yeah, waking them up to draw their blood.
Sticking needles in them
the
at
Q
3
day
a.m.
blood draws that we act on every single day.
And then we wonder, like, they bounced back after the hospitalization. Isn't that strange? You know?
Right? Or you see your patient in the grocery store and you're like, who is this? This wonderful, vibrant human that isn't a shriveled wreck that we put in the hospital and pathologized.
Hospital's no place for a sick person.
It really isn't.
Yeah.
It really isn't.
Well, that's
I used
why.
to tell my patients as a hospitalist, my sole job is to keep you out of the most dangerous place on earth, which is this. So I'm going to try to do everything I can to keep you safe and sound and get you out of here
Fall
quickly.
risk, blood clot
Fall
risk,
blood clot,
infection
iatrogenic
risk.
infection,
You want to get back?
vecuronium.
These are the key issues that have plagued us for the last,
That no one's talking
of
about.
course, because COVID is dominated.
There's no specialty. When you come into medical school, say you're a second year and you bump in, you're rotating a little bit in the hospital at the end of your second year. What's the one question everybody peppers this student
What are you going
with?
into?
What organ are you going to focus on?
Yeah.
Prepudontist.
What is that?
Just the prepuce, the foreskin, and I just specialize in that because listen, I my license plate just says with a $ for the S, schmegma.
What if you want? Maybe if students listening out there, you can be an evidenceologist like Vinay Prasad here.
He is.
And
Basically
a few others.
And many others.
There's
Many others.
10 of us.
So the rest are dogmaologists. There's
yes.
a lot of that.
And then there's a schmegmatologist.
There's a lot of
Schmegmatology,
self-proclaimed ones
Not
on
aware.
Twitter.
Lots.
So what did you say?
Most.
You say you want to be a surgeon.
I mean, I was always interested in sort of the
Policy,
overall.
yeah,
I mean, I left medical school really after my third year. I felt a little disillusioned. And
Really?
Yeah,
I didn't
I
know that.
started graduate school in public health, and I just thought, I'm going to take a bunch of stuff that I am interested in, tropical diseases and epidemiology, which I loved, and I took some extra epidemiology classes. And then I really realized I missed the bedside patient care, being with people. So I sort of came back into my fourth year, and then somebody said, what could you do in an ideal world if, money were not an issue? And I said, I think I'd like to be a missionary doctor. And he said, well, if you want to do that, learn the surgical skills, because you can read about a lot of the treatments and you can educate yourself on a lot of medicine, but you can't sort of learn the surgical skills on the fly.
You can't know what we know from a book.
Yeah,
That's true. I was oversimplifying.
Guild.
So,
You have to live it.
so
Breathe it, Marty.
that's true.
You
So
want to do the Lord's work, you got to go through
But,
it.
but
there's
to be fair,
something
I did
appealing.
learn most of it from a book. as
there's
well.
something appealing about general
You can learn a lot
surgery.
from it. There's a lot in the book.
There's
It's
something
true.
appealing about general surgery because it's training a little bit in urology and orthopedics and neurosurgery and GI and transplant with all the transplant immunology and vascular medicine. So to me, general surgery
is
was
kind of
appealing.
holistic. Yeah, right. It's a holistic surgery.
That's for me it was a similar thing. Like I thought I was going to do GI because I was just attracted to the butt and stool, but then I did the rotation and I was like, I don't like this at all. Like,
Above or below the dentate line was.
oh man, yeah, the valves of Houston were the sort of cut off. And so for me, what it was I had this crisis in second year of residency where I was like, wait, I don't want to do what I thought I was going to do, but here I am in an internal medicine residency, and I fell in love with medicine. But I left for a year and worked in tech. Because
I didn't know that.
Yeah,
What?
I worked here in the Silicon Valley, 2002 to 2003. I moonlit at a urgent care to keep clinically active, but then I worked for 2 med tech startups that both failed, and learned because I like to teach. But then it's the same thing, Marty. Like I was like, I miss there's something freaking magical about being in a room with a patient when they're at their most vulnerable and they're opening up to you, and it's just really a sacred thing,
Intimate, yeah,
it's
and
intimate, and it's not just about science. In fact, the science got a little boring after a while. I was like, okay, all right, yeah, but it's this.
Yeah.
And that's what drew me back into medicine for 10 years.
And you don't get that anywhere else in any other profession.
No.
Do you get that?
People immediately open and honest.
Yeah.
They
tell you
open
everything.
up within
Yeah,
seconds of meeting you. They'll trust you to tell you secrets they've never told their spouse. Or they'll let you put a knife to their skin immediately because of really centuries of trust that our ancestors in medicine have won from the community. They've earned that trust.
And that's why we have the symbols and the rituals and the robes and all of that.
Well, then what do you think about that issue, though? Are we losing trust?
Yeah, I worry about that.
Oh, yeah.
Yeah, with the
I'm
COVID.
in the toilet right
Well,
now.
I mean, public health lost a lot.
Yeah,
but what about,
yeah.
But like, I guess, all right.
On the ground.
A tough question for you. Honest question. Okay. There's all, doctors have to be, I think, advocates for patients in public health and important sociopolitical issues like disparities. But is it possible for doctors to be so nakedly partisan, particularly in the outward appearance, that they actually lose trust? Naked partisanship, not about the issues, but naked partisanship, which I see a lot of.
I see it constantly. But we're in circles on social media,
Well, I don't look to it anymore.
Yeah, I
It's
don't
like
either.
dumpster fire.
I think
Post and ghost kind of deal.
Post and ghost.
Yeah.
Get the hell out of
Get
there.
out.
I think
Comments
when
on
people
forums.
hear from a doctor they want to hear the science, and they don't want to hear political partisanship. And when they sniff it out, it's a turnoff. That's what I perceive. That's what I hear. And look, the people I respect the most in medicine, people like yourselves, people who have retained their scientific objectivity despite a lot of political gravitational forces to say, hey, we got to all stay on message on this, or here's the program, just sign up for it, or don't question this. And there's a lot of these people out there, and you see a bit of a community that's formed around, say, the issue of school closures. Didn't matter if you were politically
they're
liberal.
progressives in there, and they're like people opposed to school closures is a range of political views.
Pothole in a community is not a red or blue
That's a good
issue. It's a
example. That's a good
competence
metaphor.
issue, right?
Yeah.
It's knowing.
But Marty, I feel like your philosophy is a philosophy of you're an old man now. You had soup for lunch.
Dude.
You had that fish last time.
That was
we
a good
ate.
lunch.
This is the oldest young man I have ever met in my life.
Yeah.
I was built to be a grandpa.
You really were.
You really were.
Is that a Werther's original in your pocket? Is that some hard candy, Marty?
Ordering today at lunch, it's like, so this juice. Can I ask you, waitress, like the juice, is it fresh squeezed?
He's like, the soup isn't too hot, is it?
Because if it's too hot, my gums react. I was wondering. And by the way, that yes, I was going to say, I think the waitress liked you, Marty.
Well, I wouldn't notice, but
I noticed.
I don't notice those.
It's because
things.
he's a pescatarian, and the waitress was pescatarian too.
Yeah, they had a
That was our
connection.
connection. Continuing with the
back to
results
the-
of this study from the American College
I see.
for the American
Yeah.
But
Cancer
Marty's
Society.
life, I want to talk more about. No, go ahead.
But back to
That's
but
all
I
there
want
is.
to say this.
This-
But I think that I agree with a lot of what you're saying, Marty. I think you're onto something about what people want. Yeah.
So this is one of these
politically.
issues, right? The financial toxicity that we've got to get back to these issues in healthcare. We're spending so much energy on these fights over issues that are not even that central to health right now.
you're right.
Cloth masks on 2-year-olds. Look
Vaccine
at
mandates.
all the energy we're spending. The
You're right.
booster mandates on college
You're right,
students,
you're
right?
right.
These are not. Here's a real issue.
But they
in
are
America.
silly, Marty. They're silly issues. But you're right. You're right. They're
They're
You're right,
tragic,
Marty.
but let me give you a real issue. From this same American Cancer Society study, 38% of cancer patients in the United States report having had to make difficult decisions about purchasing food and clothing as a result of their
diagnosis.
cancer costs. 28% said that they spent all or most of their savings on their cancer care. And 45%, this is the kicker, if you believe in access to healthcare, if that's an important issue, 45% said they would delay or avoid any future care because of the cost.
So to fix this, by the way, what an old man. Look at this pen. Only an old man would use a click pen that he stole from a hotel. AC.
Still, I'm going to return it.
You're gonna find him
I'm
tonight.
going to return it. I don't want that prosecutor from Nashville coming after me. I mean, that guy's
Dude,
on a
that's not
trip.
even funny. That poor.
Gonna get you.
poor
Should I reach out to her?
I would be lovely.
Yeah. I often will defend people that I feel have been, treated unfairly.
Yeah, I mean, it's hard to know because we don't know the
bono.
full story. But I would just say,
Yeah, you don't know the full story.
So for this business,
Yeah,
look,
let's
we
do this.
know the
This is a
problem.
good
So
one.
what are the solutions to this? Because in my mind, there's two things. There's how do we pay for medicine, and then what the hell are we paying for, and why is it so expensive?
So some of this comes to what Vinay wrote about in that article, that we are allowing pharma to play this game of rolling the dice,
Yeah.
right? Because every time they get a new drug that's FDA approved, even though it has no impact on overall survival.
Correct. Which is a lot of 2/3 of drugs are approved on the basis of a surrogate endpoint, not overall survival, and many of them don't improve survival with long-term follow-up.
Only 5 to 19% do in
Yes.
that one study that I looked at.
By Kim and Prasad.
Yeah,
Journal
that was a
Medicine,
good study.
2015.
And this, I'm thinking, why isn't anyone else doing? Why isn't anyone else doing this study? I know why. Because when you get pegged to a specialty in medical school, you come out, you're put on a hamster wheel,
Yes.
Yeah.
and you're whipped, and you're told more RVUs in order to get paid more. You got to do more. And this message that we're sending out to doctors across the country, and that is the way to fix the problems in healthcare that we are dealing with is for you to work harder.
Yeah.
But Marty, along these lines, like all of the incentives in academic oncology, like for career incentives, are run more trials for the industry, do more consulting for the industry, serve on boards that help promote the industry products, even those ones that are kind of marginal. And I think we have to concede, like pharmaceutical companies do great things. The first 2 doses of vaccine in older people are tremendous good, and many cancer drugs are tremendous good.
Amen.
But because you have some drugs that are really good, you get away with selling some drugs that are very marginal. And a drug that has no survival benefit, real toxicity, that isn't just
cost.
And real cost, that's not just a neutral drug. That's a harmful drug, and it's reallocating wealth. As you point out, it's taking wealth from society and giving it to rich shareholders.
You know what? You may have written a book on this.
It's called Malignant.
Malignant.
How
It's a
bad
great book.
policy
That was the
and bad evidence.
First time we
are
ever
people.
talked was
That's
by
true.
Zoom.
I interviewed him for MedPage, I think, on that book a while
And since
back.
that conversation,
It's been all downhill.
3 people have read Malignant.
Dude, that's two more than last time.
Your problem is that it was published by Johns Hopkins University Press, my institution.
Oh, right into the...
Are you saying university press books aren't the hard-hitting?
They don't know how to
They
do
found
marketing.
quite a few of those books in the wastewater review they did.
He uses 2 to prop up his desk.
So here's some good news. So on Friday, Equifax and the other 2 credit agencies.
The medical debt. It's not listed.
That's right.
Yeah.
80% of medical debt is not going to be affecting your credit history.
That's great.
And that's a result of a lot of advocacy. And I think we as physicians, nurses, clinicians out there have tremendous clout in the community to go to these organizations and say, look, be fair and honest with people.
Yeah. Don't
violate our sacred trust with people by harassing them and ruining their lives financially.
You know, it's so interesting. There's like 2 problems. Like one, we spend like 20% of GDP on healthcare, which is horrific and way more than any other like comparable nation. And 2, even though we spend all that money, we still have like all these problems with debt collectors and debt and out-of-pocket expenses.
A lot of people are getting rich.
Yeah.
Everyone
like
in
you said, it's a
healthcare
transfer of wealth.
It's a transfer
of wealth.
Everyone in America is getting rich in healthcare except for one group, and that is
professors like
some people, nurses and a lot of physicians.
like those of us who are like working.
Physicians,
Marty, slide
nurses,
a little over because you're out of focus. There you go.
A lot of nurses and physicians have basically had wage stagnation for 30 years.
Yeah.
Remember when COVID hit and then they cut everyone's pay and like didn't give them bonus that first year while they pocketed that $100 billion bailout from government?
And now they're trying to introduce legislation to limit the amount you can pay travel nurses. So it's kind of like, who can we get back at for all this? How about the nurses?
Oh, they're doing that. I know because.
It's going to pay what the market will bear because there aren't enough nurses because you treat them like crap because you put them in jail for making a mistake that could have been rehabilitated, you know?
So a lot of nurses and physicians have had wage stagnation, but the one stakeholder in healthcare that has really gotten hammered is the patient, the consumer of the system, right?
No one worse than
Who cares about them, Marty? We're talking about us.
So here's an interesting analysis that my team did where we looked at all federal spending that goes to healthcare in its hidden forms. So, for example, we know that 20 to 25% of the federal expenditure goes to Medicare and Medicaid, either through that FMAP program where they send money back to the states for Medicaid. But it's, you'll hear 20% of GDP, you'll hear different numbers.
Yes.
But 24% of the federal expenditure of the budget goes to Social Security. And do you know where seniors are using their Social Security insurance?
For medical bills.
Medical, 50% according to Kaiser. Co-pays, deductibles,
So that's
non-covered
even more money in
insurance.
the healthcare system.
So you made an estimate of it was close to 50%.
Yeah, because it's almost 50%. It will be 50% this year because the Defense Department has its own healthcare system. That's 15% of their budget.
Wow.
They have TRICARE. They have doctors and hospitals.
It's
the VA,
5 more airplane carriers.
It's a lot of money. And then the VA has its own system. That's about 4.5% of all federal spending. And then we pay for healthcare benefits. We buy health insurance as a government for 9.1 million federal workers. And that's about 1.2% of federal spending. And then interest payments on the debt are about 6% of all federal spending. This year it'll be 7 to 8%. I don't know any expert that thinks that number's coming down. Like we finally are bringing down our interest payments. So that's really healthcare debt. If we're spending all this money on healthcare and we're paying money on the interest payments, that's healthcare debt. So when you add it up, it's 50%.
And that's a massive redistribution of wealth.
Yes.
It's going from us to them. like whether it's pharma, whether it's big, CEO salaries, whether it's air ambulance companies, private equity firms,
insurers, academic hospital centers who are nonprofits,
GPOs.
Everyone's nonprofits, but they got 4 skyscrapers going up in the nonprofit world of hospitals. Yes, every new skyscraper in our nonprofit.
I was working with 60 Minutes on a piece about GPOs that's going to air, I think, in the next couple months. I'm not in it, but I worked with them a lot, and it's going to be a pretty interesting. No one really knows what a GPO is. We wrote the first piece in the medical literature in JAMA, defining what a group purchasing organization is and the many games, including kickbacks, that cause some of the drug shortages that we have because they give sole supplier contracts to a company through kickbacks that they get from that company, which are legal through this loophole. There was an amendment passed in 1984, I believe. It was basically, it's called the safe harbor exclusion to some kind of anti-kickback clause or law. And so that's enabled GPOs to take a kickback. PBMs do the same. So a couple of easy things. If we want to fix healthcare, get rid of secret pricing and get rid of kickbacks. 2 simple solutions. So the 60 Minutes piece will be good on that.
But Marty, I have a philosophical question for you. Obviously the U.S. trajectory in healthcare spending, and we have to also point out, it goes hand in hand with we're not actually providing much better care than other nations. Often it's worse care, worse outcomes. There are 2 ways, I think, philosophical ways we might address it. One, incremental solutions to try to curb this, bend the arc of healthcare spending downward. Or 2, we might wait until it becomes a catastrophic situation, and then we'll have to do something reformative. And I worry that every political cycle that I've been in, I've been very excited about the prospect of healthcare reform and bending it. But every time you get closer to the finish line and the lobbyists come out, the stakeholders come out and they lobby you to death. Marty, they got dinner, drinks. They lobby you to death. And so it seems like we have no ability to make incremental reform. I worry we're going to reach a catastrophic situation where healthcare spending is just so much that it literally is economically crushing, and then we might have to do something about it.
I would argue we're there.
We're there
already. Yeah, but it hasn't hit the tipping point in the sensibility where it's like a existential disaster in the minds of the public, even though it is. And
it is.
But that would then allow the metamorphosis of this caterpillar that's been eating all the resources and destroying everything into a butterfly, some phase shift in healthcare.
It is.
To 3.0 that I call it.
Yeah. So let's say a household has a combined income of $120,000.
In the Bay Area, you'll be poor with that kind of
you're broke. You're on the street. Broke.
I think the average income in America is 50 or 60.
56, right?
Okay.
Yeah. But in other parts of America, that's
right. So let's say let's say they have a combined income of $120,000. They're going to be paying about $35,000 in taxes, of which half of federal spending goes to healthcare in its many hidden forms. That's about $17,000. Add to that the cost of health insurance for a household, $22,000. It's about $40,000. So about a third of their earnings through public and private spending on healthcare is going to healthcare, and it's from their earnings. Let's be honest. It's not I didn't have to pay the government. Medicare paid. I don't have to pay. My employer paid. It's out of the pool of money of wages and or wages and benefits. So I'm actually optimistic on the future of healthcare, and I know the stakeholders are swatting down any reform, to try to address these kickbacks and other things. But employers now are fed up, and they're pushing back, and they're saying we're just going to go direct with these doctors through direct primary care. We're going to go to direct with the hospital, do a direct contract. We're going to bypass all this middle industry. And these entrepreneurs and innovators are doing condition-specific treatments now, so you can channel somebody into a tract where they get great hand-holding and care for their diabetes,
hip replacement, heart disease, whatever. Yeah, centers of excellence, that whole thing, or actually whole systems of excellence. Yeah.
I hope you're right, Marty. But let me give you one counterpoint. 2 things we talked about. We have aggressively boosted adolescents and young people, and then we're going to give them the 4th dose if Moderna goes through. Those are very similar to things you're talking about. They're making a company rich. This company's getting billions. They got 79 bills in the bank from these vaccines.
Government spending.
They're not going to keep that gravy train going if they're just vaccinating older people season to season. They need to get us all. And the FDA is saying we don't need to see severe hospitalization as the endpoint of the randomized trial. We don't need to see symptomatic COVID as the endpoint of the randomized trial. We need to see non-inferior geometric mean antibody titers. They put the bar in the toilet, and the government's already committed to buying the product. Okay?
Yeah.
This is an example of what you're talking about.
Yeah.
This is why that number, because this is happening in COVID. It's happening in every disease. Everything. Rheumatology, cancer medicine, cardiology.
Opioids.
Opioids. and that got us in a lot of trouble. Everyone wants their pain to be zero, but it gets you in a lot of trouble. Shortens life expectancy. So I feel like they're just like it's like a hungry hippos game, and these companies are just eating all those marbles. And you come along and you say something like, hey, maybe guys, like before we start boosting 12-year-olds, maybe we should get like some net clinical benefit data around here. And they say, you anti-vax, Marty. They're going to call you like anti-innovation, Marty. Wants to cut Dr. Death, Marty. They'll call you that for these things.
Yeah.
The lobbyists are getting ready.
Look, we got to keep fighting.
We got to keep fighting.
We got to keep fighting based on the data and the scientific method that we've, valued.
That may be one positive that comes out of this COVID debacle too, is that people start to really wake up a little because there's now loud voices that have reasonable influence that can say, hey, you know what? Remember all the stuff that happened during COVID? Yeah. That's just a symptom of the bigger problem.
It's just
nothing. It's like it's a rounding error on what you're getting jacked every single day. You know, you complain that you haven't gotten a raise in so long. Why do you think that is? Look at how much is taken out for healthcare, and then here's what's going on with the government spending. Oh, and by the way, the interest on that is this, so your kids are going to be paying that. And guess what? You still have shitty outcomes. And guess what? We still,
and if you do anything wrong at work, the work job you have to have, and if not, we're going to put you in prison and file criminal charges.
File criminal charges against you. So don't even go into healthcare.
It's like a modern day feudalism.
It kind of is. It kind of is.
I mean, the opioid epidemic, for a moment, we were focused on it and the root causes. That was really, for a moment, that was a snapshot of healthcare.
Yeah.
It was a snapshot.
One slice.
One medication,
one ring
of
in the tree.
Hundreds out there. You got a window, a peek into how industry was dominating the narrative, how many people had a piece of the pie, but the blame game was going around.
Yeah.
But Marty, you know what's going to be like that? There are definitely some people after COVID truly suffering, and there are people who have had prolonged hospitalization who need a lot of medical care and attention. But we have a long COVID industrial complex coming.
Oh, yeah, it's coming.
We've got more NIH grants flowing into long COVID research. We've got every hospital sharpening their machines to get people in for, scans, PFTs, echoes, imaging, sequential, these clinics. They're going to suck up healthcare money. And if that made people who are suffering better off, great.
Yeah.
Pay it all.
But they're not going to even do the studies. They're going to do like the Moderna booster, no endpoint studies, no control arm, these kinds of things. They're going to do like the fourth dose,
Yeah. Doing an MRI on everyone with long COVID does not help them.
No. Yes, but it's coming.
Oh, yeah.
It's coming.
Oh, 1,000%.
It's here.
And the thing is, no one will talk about this.
No one will talk about it.
No one will talk about
this. Because it sounds callous.
It sounds callous. You're lessening the suffering of these people. You're saying it's not real.
You don't care.
But they don't realize is that MRI is preying upon their suffering.
Yeah,
the suffering is real, but they're not addressing the root of the suffering. They're preying upon you and using you as a pawn in a scheme to reallocate wealth.
And it's like a Stockholm syndrome.
Yes.
You love your captive.
Yes, you love them. Exactly.
Oh, man, if insurance would just cover this agent that will help my long COVID, everything would be okay. And the pharma guy's like, yes.
And I guess what? We always paint the insurer as the bad guy. The insurer, ACA, has capped their revenue as profit. The medical loss ratio has been capped at 20%. So the insurer actually wants the pie. They want spending to go up. So they're going to be having put a lot of limits on this year to year. But over the next 10 years, they're going to capitulate to it.
It's like the $10,000 COVID test, right? They'll just pay it.
I saw Francis Collins, the immediate past director of the NIH, make an announcement. He's still there. He's still at NIH, and now he's head of the Health and Science
the
technology.
thing that what's the name? Eric Lander got booted for.
He's now
for being a dick in a no-dick zone.
These guys, man, they serve.
So they brought the guy who was
they serve terms like
African
African presidents. It's like they will. It's they
like Putin. Wasn't he president? Then he was not for 4 years.
Prime Minister.
Medvedev or whatever took it over.
Although unlike Putin, Collins is a nice guy, but
he's a nice guy.
But the terms,
but he's not good at the job. No offense.
Well,
not good actually.
So here's an analysis.
I met him once and he was nice to me. So
he's a very nice guy. He's a very nice guy, as is Fauci.
Wasn't good. But okay, that's okay. No, it's okay.
I've disagreed with him on maybe 20 aspects of COVID strategy.
But even before that, the genome, we put all the money in the genome.
That's a controversy no one knows about.
He was quoted in the New England Journal of Medicine saying by the year like 2015, when you get your blood pressure pills, we'll do a genome sequence and give the one right for you. That didn't happen at all, and he's never punished for his grandiose proclamation. Okay, anyway, nice guy. Go on.
And
he plays a good guitar.
Did the
mean guitar.
Did the sequencing of the human genome faster, right? There was it was the big controversy was, does the government sequence the genome
Craig Venter
or let the
was-
private
Craig
sector?
Venter.
Yeah.
The private sector did it faster and cheaper.
Yeah.
That happens sometimes.
But
Even a socialist like myself has to admit that happens. That happens sometimes.
well, the history is written by the victor, right?
Yeah.
So Collins told the story of how they sequenced the human genome with all this crazy money all over
watched the
labs
PBS
across the country, fed all these universities, and the promise was as soon as we do it, we're going to be able to, change the genome and cure all these diseases. What diseases have been solved? And the ones that we're now seeing CRISPR that came way after the sequencing was done by the private industry.
Right. It was disappointing, and
disappointing.
And they just sunk too much capital in it. That's what they do.
So they made an announcement about long COVID funding. It was some crazy amount of money.
I think it's a nearly $1 billion, wasn't it?
More than that.
More than that. Okay.
Way more than that. So we just did a study. Go ahead.
I was just going to say it's an insidious reductionism. Like somehow we can reduce this complex vibrating entity of human into like DNA. And so if we throw enough money into that or a drug or a one procedure or whatever, so long COVID is an MRI and a this and a this, it's taking the whole and turning it into parts instead of going, wait, but what's really going on? It's biopsychosocial, as my friend Dr. Rachel Zoffness says. Everything is. But anyways, back to you.
But no, and even in the DNA thing, like, there's that allegory of the cave in Plato where it's like imagine soldiers are chained and you have a lamp behind you and you only see life through your own shadow.
Yeah.
You may not know what three-dimensional space is. And genome sequencing is like the shadows on Plato's cave. Yeah. The inside of a cell is so complicated. There's the DNA, there's the RNA, there's all these parts moving, and you just see like a projection of the DNA sequence and you think you can solve everything? No.
Well, that was the storytelling of it. It was a great story.
Yeah,
Once we can
unravel,
using a computer model, which is what humans understand right now in history. They understand the computer model. Brain is computer, DNA is
the
computer.
Human
binary being, yeah.
Right. So that's a controversy I don't think people are aware of. But anyway, giving them the benefit of the doubt, we looked at Johns Hopkins. We just did this study, my team, put it on the preprint server. NIH funding in 2020, the year of the pandemic, less than 5% of the budget went to COVID research. And of the money that went to COVID research, there were like 6 grants on how it spreads compared to 250 grants on other aspects of addressing COVID, socioeconomic disparities, and other topics in COVID. Important. But how does it spread?
Right.
And
there's
none.
Like a big chunk on remdesivir. Right.
There was no funding for studying masks in children. No study on children at all. 2 studies on masks. One of them read out like a year and a half later. Why can't the United States government, with $43 billion at the NIH in 2020, why couldn't they get the key answers immediately in 1 week to all the big COVID questions?
That's why I'm saying that he didn't do a good job. This is a total failure.
Total failure,
of course.
And as a result, we didn't have the evidence to answer the basic questions on COVID. So what did we do? We gave opinions, and politicians gave opinions, and the country got divided.
And masking kids is a failure to run a trial. Like, let's say you run a trial, you might have learned things that we don't even expect. Like, you might learn kids, it actually does work to wear surgical, not a cloth. And actually, maybe you might learn there's a relationship between the cases per 100,000 in community and the efficacy of a mask, an interaction coefficient there. It might be there. You might learn some compromise, and you might actually use science to decide the policy. But instead, you don't do the study, and then it becomes quickly. Politicians seize that as an opportunity where it is, a visible mark, and then they claimed it, and now it's a political question. It's not a scientific question anymore.
And what's the cost of that? It's massive.
Oh, massive!
It's way more than any of the spending they would have spent on the research.
And it's affecting child vaccinations, public trust.
Yep. It's tearing society apart.
Society
it literally
apart.
tears us apart. I mean, because you're having the science TM, the science
the truth.
Tell you the truth.
Yeah.
The truth is telling you
the Truth
you're
Institute.
You're stupid anti-vax bad person.
Yep.
If you think a cloth mask might not work in a 2-year-old when they take it off for 2-hour naps. Like, if you think that, you're crazy. So
my daughter's friends know who I am online, and they're like, "Is your dad an anti-masker?"
Anti-masker.
Anti-masker.
Yeah.
And then they asked, did you get a booster yet? Because we all have our boosters.
Yeah, what's wrong with you?
Yeah. And then she was like,
you can't come with us to the museum.
Yeah, exactly.
The
museum.
But they've all bought into this.
Yeah, it's a thing.
The group think is pretty bad, right? So the Proceedings of the National Academy of Science published a study, I think 2 months ago now, on the different types of masks and the transmission with a 20-minute interaction, close together, close contact within 20 minutes of in a 20-minute period. So they broke down the rate of transmission with an N95 with and without a nose piece with a surgical mask. And you could see the transmission rates, go up with the quality of the mask. Why wasn't that done on week one? Instead, they goofed around. They were funding research they spent twice as much money on aging research in 2020 at the NIH than they did on COVID. We found that in our study.
Wow, really?
Yeah, now aging is important.
Fauci and Collins have to live forever.
Yeah.
Come on.
They can't pivot. I mean, the organization
they couldn't pivot.
They can't pivot.
And because of that, we paid a heavy price because there was this void of data to arm doctors and nurses to answer the basic questions everyone was asking us. How does it spread? Do masks work? When are you most contagious? How long do I have to quarantine for? We could have answered that in 10 days.
Of course, Marty. Of course. I mean, you're really onto something.
What's the IFR?
Oh,
yeah,
right.
What's the
and then
risk
they get mad,
by age?
They get mad at these guys for running their study on a shoestring budget, but why are they the ones having to do this? Yeah. You need to be doing this.
Well, our study on natural immunity that we just published in JAMA.
Well, that's heretical. And you should be burned.
Well,
I can't believe they published it.
LinkedIn agreed with you. I posted the JAMA study. Just
I
thanked my
hope
residents.
They censored it.
Right, they censored you. They took it down as misinformation.
Yeah. They took it down.
There's probably some 26-year-old there who knows better than you, Marty.
Of course. Who's got an N95 respirator outdoors at the pool.
They're probably, and they got the tan line.
The tan line around it.
The media called me to do an interview about LinkedIn taking down the JAMA study. There was no commentary. It was just testing the blood of people who had the infection.
And it was published in JAMA.
Published in JAMA.
I remember your study.
JAMA, not,
Mama JAMA.
JAMA.
Yeah, not JAMA Light or
not JAMA.
Yeah, Mama JAMA.
JAMA preprint.
JAMA Landscaping, Total Landscaping.
JAMA Gardening.
Yeah.
And
Marty, a little this way. We got the defocus. There we go.
Okay.
Yeah.
So I put it on LinkedIn. The media called me, hey, LinkedIn took down your post on just posting your JAMA study.
Yeah.
So I don't know why they did that. In 15 minutes, it went back up. But why did the NIH not fund that study? I heard from an NIH researcher in New Jersey who has an entire career, 30 years of continuous NIH funding. And he said, I applied to do this study and got the top score, and it was not funded.
Oh, God. Well, I don't know. To be honest with you, I honestly think that if you, one of the biggest jobs of the NIH is to allocate funding. And they currently have a very complex system with study sections, et cetera.
Bureaucracy.
A bureaucracy to do it. And it keeps a lot of people employed. If you took, the next $1 billion and you randomly assigned $500 million to the way they're giving it out right now, this total shit way, okay? And $500 million, it's called a modified lottery. They get everyone's names who submit an application. They just check, is this person at a reputable institution, like a top 1,000 institution? Did they spell things correctly? Is it a one-page proposal? And then they just literally randomly give out the money. I bet if you follow those two portfolios of research for 5 years, 10 years, they'll have better, maybe even better outcomes. More scientific advancement in the randomly given. That means their bureaucracy is probably, I suspect, so shitty it would underperform even random allocation of money. They have never, for a science organization, run a single experiment on how to fund research. They're slow. They're antiquated.
Cronyism.
And this guy has been NIH director since, when? It wasn't. It was first Obama, 2009. Collins. He did it for 12 years. They don't want to turn up. Fauci's been the director for how many years? 41 years. I think he's been 41.
He's been at the NIH.
But 30 years as the director.
Yeah.
We need turnover. You need new ideas.
Do you know he's not an infectious diseases doctor? Did you know that?
An internist.
I wouldn't have guessed.
Rheumatology fellowship. I don't hold it against him, but how does the media crown him the nation's top infectious diseases doctor?
He's
by Lord Zero COVID.
He's the Pope. He's infallible.
Yes. Well,
he never made I dare you to name one thing he said wrong. Just one thing, because he got
during COVID.
Yeah,
not a thing.
It was perfect.
Perfect. Yeah, really 100% batting average.
Yeah.
I just saw that he said that we might have to lock down again. So maybe 110% batting average.
He answers everything with an open-ended question.
I'm going to say something a little heretical. I don't think the study can be done. I wish we could look back over COVID when nobody was going to the hospital, when they locked everything down and nobody was getting care, separate out the screening failures and the necessary care failures, and look at outcomes for people who didn't get standard American care for those months. And see what happened.
That's a good.
So
people are going to be working on that space. I'm intrigued.
Are they going to be working on it, or do they not want to know?
Nobody wants to know.
Where is the definitive study of child hospitalizations in districts where the kids were in school free and clear with no mask, open the entire time, versus lockdown and masked?
Yep.
Where's that study?
Lockdown save lives, Marty.
So Tracy Hogue did that study and showed no difference,
Heretical.
right? And she had a bear of a time getting it published, and the media basically did a takedown of her study. She was scheduled to go on NPR, and they did a pre-interview, and then the night before told her, "Oh, we're not gonna, we're gonna go a different direction or something." And then someone told her, "Hey, I heard a pediatrician saying, this is why everyone has to wear a mask, including a cloth mask in school." So this is NPR. This is why Sonia Sotomayor thought 100,000 kids were in the hospital at one point. She's listening to NPR.
I mean,
and all
the
those.
media bubble, the New York Times, NPR, they've been terrible.
The Washington Post.
The Washington Post, terrible.
It really is that bubble, and that's how people get their data.
I want to be perfectly clear. Pre-COVID, there were Wall Street Journal editorials that attacked some of the research I did because, it was very sort of critical of the pharmaceutical industry.
Yeah.
And I cursed the Wall Street Journal, okay? And I really loved the Times, and I loved WAPO, and I loved NPR. But on COVID, they have been so bad that the only sensible person at their organization, David Leonhardt, they want to throw it. Every week there's a new Vulture article about David Leonhardt, the left's pro-COVID czar. They think they're dogging this guy.
They're going after him.
They're going after him.
Yeah, but the public likes him because he's reasonable.
Of course, he's the last sensible person.
Yeah.
And he's not even I don't know. They portray anyone who is if you're not willing to hold your breath when you drink your bottle of water and put your N95 mask back on, they portray you as unreasonable.
Yeah,
it's ridiculous.
that's right.
The synthesis position is in short supply.
Yes.
Yeah. I mean, it's either thesis or antithesis. There's no synthesis. And, what we're trying to do is talk about a synthesis. People consider us antithesis adjacent for even talking about a synthesis.
That's right. You're not allowed to.
You can't.
We just did this analysis of Michigan versus Sweden in terms of COVID outcomes because Sweden was basically open the entire time. As a matter of fact, Sweden made a major mistake early. They were slow on the nursing home protection.
Right. That was their big thing.
Compared to Norway and the others.
But they kept those elementary schools open.
They kept almost everything else open.
That's because they hate children. Did you know that?
They don't have as many children in Sweden, but
I hear they love them, and I hear they have higher spending on children than the U.S. does.
Is that right?
There's
Yeah, of course,
fewer
the
per
Nordic
capita, I'm
countries.
sure.
Yeah,
So,
of course, yeah.
Yeah, they do love their children.
So Michigan had some of the strictest policies in the country, right? I mean, just parks were closed. Schools had some of the longest school closures of anywhere in the country.
Someone told me when we went to these
and-
big grocery stores, if you strayed out of the grocery store aisle to go look at the lawn care supplies, they tape that off, and then you're reprimanded for that.
That's the kind of stuff was happening in Michigan, right?
Because
so
you
Michigan,
can't garden.
Of course not.
COVID feeds off gardening.
We know that.
So it's interesting. Michigan and Sweden. You may say, why did I pick Michigan? Michigan has the identical population of Sweden. They have the same age distribution. They have
Equal number of IKEAs.
Yeah. Freezing cold winters.
So actually the waves, when people compare New York to other states, it's not a fair comparison because the treatment was not as mature when New York got hit, right? It was too early. So the
High case fatality rate.
high, right?
Yeah.
So you can't make a apples to apples comparison. But Michigan and Sweden had identical concurrent waves of infection, same climate, right? And so in doing this analysis, in the end, in the final analysis of the two regions, Michigan had about 34,000 deaths. Sweden had about 17,000.
Wow.
Okay.
Age match and
Same
population
average
match, yeah.
age. The average age is 40 in Michigan, 41 in Sweden. Percentage of the population over 65, 18% in Michigan, 20% in Sweden. So even the distribution. The only difference that is significant is the obesity rate, 36% versus 20%. That accounts for some of the difference.
Yeah.
But remember, they had half the deaths in Sweden as Michigan.
I think when
half.
the final tally is in and people do really formal global analyses, Sweden, which was the pariah state because they disobeyed the experts,
The media. The
Lord
media went after
Zero
them.
COVID.
they didn't pray hard enough to Lord Zero COVID. They're going to be looked at as having fared pretty well and done okay.
Why couldn't and I remember the media was trashing Sweden, right?
Totally. I mean, they had
course.
the cover of the New York Times was the Swedish chef on a ventilator with a peg tube.
Because Sweden was an existential threat
The
to
Foley.
it was a threat to what we were doing.
Yeah,
Yeah.
it was a threat to the edict from on high.
It's amazing because the left in this country loves to point at Europe when
Because
we're
they
looking.
have better nationalized health care,
better
social safety net,
better
more
cohesion,
taxation,
more taxation.
which I used to like until I started making money.
Me too, brother. Me too.
Well,
But then when COVID happened, it's like, well, the Europeans are crazy. I mean, they're not masking kids. They're just nuts.
And like, look at the way they talk about the Norway and Sweden, and we have to wrap up after this because
you gotta go. Yeah,
and I'm also melting.
Oh, you hot? Oh,
yeah, the temperature got up.
I'll turn on the AC. Hold on.
turn the French fry lamp
my
down.
jacket.
Oh,
God.
Metallica T-shirt. That's worse.
That's what you're
I'll
hiding.
turn on the
Why were
AC
you wearing
while-
that coat, man? Take it off.
Well, I
it
started
looks
out
good.
cold,
Yep. That's
Okay.
true. It's been cold today.
and I gotta look good. I started out cold.
So
but now I got
why couldn't the New York Times, and the fact checkers, why couldn't they go to Europe and just describe?
They can't fly on a plane, Marty.
Oh,
That's
right.
dangerous.
I
That's
forgot.
Russian roulette.
I forgot. So once they got quadruple boosted, why couldn't they go to Europe and just do some reporting on the schools that were open,
They
free,
still
and clear
haven't.
without
They
masks?
still have never done proper reporting on how normal it is in Europe for kids under 12. Many countries they didn't even mask them.
Well, they recommend against masks.
Well,
in
the
kids
WHO
under 12.
under 6 they recommend against, and then from 6 to 12 it's like on a case by case basis.
Well, they say consider the psychosocial impact.
Yeah, well,
so it's not even a
well,
blanket.
we don't accept
yes.
that. Our AAP knows that the moment you turn 2, you're ready to be a good person and join society
And the
as
Europeans,
a civilized person.
And the European CDC says kids should not wear masks in primary school.
Yeah,
And Ireland
heretical.
has been basically, open, free, and clear with schools. So where's the data on that? Like, where are we going to learn? Are we going to study the largest intervention in public health history? Or are we going to just follow the narratives that we've been believing? Where's the funding? Where's the NIH funding to say, let's study the schools
They don't want
properly?
to study it. I mean, you need new leaders to. You think that a person who went on TV, that's another problem. The guy who gives the funding out is the guy advocating for policy. That's a huge conflict of interest. Nobody wants to say anything about Fauci because they're worried about their funding.
That's a huge conflict.
It's a huge conflict of interest.
Yeah,
In
I've heard that from many people.
Yeah, I've heard that from
They
many.
don't want to speak out because, well, I get my funding through
That's right.
those guys.
That's right, especially in the HIV community.
Oh, totally.
So the Baltimore City schools have teachers that are very frustrated with the teachers union. And that's an important point, right? A lot of teachers had serious issues with their leadership. And so just like pediatricians sometimes have serious issues with the AAP.
They say faces are an evolutionary nuisance.
Mine is, I know that.
They say, what do they say? They say that you may be worried about kids not seeing faces for years on end, but don't worry. There are no studies that show it's bad.
Oh,
Those
yeah,
are-
yeah.
faces
There's no
are-
studies.
It's a parachute, yeah.
parachute.
And
Yeah.
we've never done it in human history, so it can't possibly be bad.
How to
No,
mislead with facts.
Yeah.
There are no studies showing. Yeah, you're right. There are no studies.
There's no study showing the 20-year outcomes of the COVID pandemic. Did you know that? There's no study showing
There's
20-year
no
outcomes.
studies showing the 5th generation effect of masks.
There's not a single
Not
one,
a
Mark.
single one,
And I mean,
or vaccines.
for that
except
matter. Yeah.
except in the deer, or maybe they've gone through 5 generations. I don't know. Maybe the
5
rabbits.
generations
The
of
rabbits. Or
deer.
the hamsters have 5 generations.
Hamsters have an average life of 6 days. So
just
you can
making
study
shit up.
15. No, it's about 2 years, I think.
Yeah, I have a
2
hamster.
years.
I was
Do
going to
you
say,
have my-
if it's 6 days,
Well,
this
if-
hamster is like a nonagenarian.
Mine-
If you really love Lord Corona, Lord Zero COVID,
Yes,
you will
Lord Zero.
you will mask the toddler.
A.
You'll be willing to accept as many boosters as Albert Bourla himself tells you,
A, B for life. B.
and you'll have to call
He's
the,
the
you'll
de
have to
facto
call the
director of
hamsters.
the
You'll have to call
CDC.
he's the, of course.
Yeah, of course he is.
Actually, he is the EUA threshold. If Albert Bourla says, and if Israel does, that's our EUA criteria.
So we talked to these. I was interested in doing a study on schools. And, my research, we basically try to study the things in healthcare that are very important that no one else has studied. That's basically what we've done with opioids, with healthcare costs, drug pricing, so many different things.
Penis reduction surgery.
That we haven't covered, but we are interested in breast augmentation because we feel that people, I should rephrase that. We're interested in understanding the effects of breast augmentation because we think there are a lot of spine problems and back pain long term because the frame is not designed for that added weight. And women are never counseled about that as a side effect.
Interesting.
But you're a strange type of person. You research and then have an opinion because that's not good.
You're not allowed to have an emotional connection to your conclusions when you see
I think the
how
modern
striking.
ecosystem is you conclude what's right,
And then you tweet.
right.
and then you find articles that support your conclusion and publish those on MMWR.
And then the fact checkers go.
And then the fact checkers.
So we've talked to the teachers, and they were saying that there's a group of kids in Baltimore City that when the schools went virtual, The kids never logged on. They never saw
they're
logged on
lost.
from
These
the
are
kid.
lost children.
And then when they went to
terrible.
back to in person
They
eventually,
were just lost.
they never showed up.
Oh my God.
These are kids that we harmed. The system harmed. Right?
Irreparably. Yeah, I mean, like that.
We need to find these
We need to
kids.
rescue
right?
them.
Rescue
We need
them,
to
yes.
find them and bring them back and spend extra money and handhold them and offer them to come back into the system with extra help.
And then make a Hollywood blockbuster about it, and we'll become rich. What do you think? On
Might
the backs
get
of
us
these
to-
poor kids.
Do you have the same modest financial goals that I do?
Just $1 billion?
Just $1 billion.
My wife told me
Just
my
one.
goal for you at some point is that to be able to say, I married a tycoon.
A tycoon.
And I'm like, I don't know the definition of tycoon, but it's an asymptote. I'm not even striving
Sounds
for.
scary.
It does.
It'll
doesn't
be
it?
the title of his biopic movie, Tycoon, the Zubin Damania story.
It's the unauthorized autobiography of Z-Dog MD.
How a modest Central Valley boy rose to riches and took over the largest media empire in the world.
Yeah, I think you are the biggest influencer in healthcare.
I like to put that on bumper stickers,
I mean,
but I have
seriously,
no evidence of it.
1 billion collective views. I mean,
Are you at a bill?
Over a bill.
Wow.
Yeah,
Because
When I-
Facebook has a lot of views.
when I give grand rounds at institutions, people will often bring up that
But 100 million is his mother watching.
Yeah. Oh yeah. Oh yeah. And then 100 million emails. I saw you in VP.
what
You
do
better
do,
be careful. He's very handsome.
what do you do with emails? I struggle with emails.
Oh, I still struggle with them. You know what happened is I closed all my Facebook DMs. I closed Twitter. You can't reach me. It's just like it's post and ghost by my team.
Good for you.
The only way you can reach me is through my website contact form or my link bio form that emails me. And I've just gotten really good at scanning
LinkedIn.
those quickly. Yeah. LinkedIn, people can message me. I don't read them.
See, I like
essential.
LinkedIn because it's not shouting. You can curate it. So if somebody's
That's true.
uncivilized,
Yeah.
which is basically defining
Yes,
Twitter.
that's social media. Yeah.
Yeah.
And that's why good for you for getting off Twitter.
Here's how I do emails. Okay. Patient care number 1. Okay. Then like research projects and things like that I'm writing that I think are really important.
But how can
number
you
2.
tell what's what? You can tell from the subject line.
Or the person who sends it. Well, patient cares. I know the person who sent the people.
And this
who
is your
write it.
work email. This is like your UCSF email.
It's a mix, probably.
I guess the research stuff will. Yeah, it's all UCSF. I mean, that's but then
Work. Yeah. Only work emails I open have the subject line "Final Notice."
third warning.
Third warning.
Overdue.
Right.
It's like Marty, you haven't complied with your 4th booster
Your
requirement.
coding. Yeah.
I'm
DC.
remote work.
I'm 100% sure I'm no longer adjunct faculty at UNLV because I never accepted their invite for my faculty email. And that's where they send all the requirements like you need a PPD, you need this, you need that. I'm like, no, I don't. 'cause I never got it.
Mandatory virtual training.
Exactly.
Yeah.
On equity and inclusion and sexual harassment.
Or on how to use Zoom. There's a whole like virtual on how to use.
If it's healthcare, it's Microsoft Teams.
So the
Okay, we do have to
DC.
wrap up.
Oh, yeah.
Okay, we got to wrap up.
Okay.
We got
Last point.
Yeah, go.
I don't know if this is a good last point.
Okay. End on a happy
Well,
note.
DC is going to mandate boosters to keep your medical license.
Oh my God.
And so I'm not going to do that.
No way.
No. So in New York, they announced the same mandate. 25% of healthcare workers said hard no.
Yeah.
And so they backed off the deadline. In DC, the deadline was March 8th. A lot of people didn't get boosted, right? Because if you're young, healthy, or had hybrid immunity,
To keep your license?
yeah, to keep your
are they
license.
insane?
So they are the only state that's pushing hard. So come March
No,
31st,
I think this state, well, at least the UC system has to be
that's the
boosted.
system.
UC.
That's
so
a
I have
system
been
thing.
boosted.
Against
But
your will. Yeah.
you're not losing your license, right? So
No.
this is a threat to
Just
lose
losing your
license.
income.
Yeah.
Yeah.
I'll
Yeah.
have a license in other states.
Well, I mean,
but-
I'm just getting a product that has very, like, no proof that it benefits someone of my age, and nor any proof that it
don't
benefits
talk
any of my
data.
patients.
I'll send
Yeah,
it to
I
the
know.
fact checkers.
The fact checker.
So, positive thing. So the students get it. The students right now, they want to be a part of something larger than themselves. They want to. Social justice is a generational value, and they believe in addressing the underlying issues that are bringing people to care, not just playing whack-a-mole on the back end. And they're watching this sort of greed industrial complex that goes on that violates everything sacred in the medical profession. I mean, Jonas Salk donated the polio vaccine.
Mm-hmm.
They know that. And so they see what's happening today, and they don't want to be a part of that. And I'm so inspired by these young people. So I just thought I'd mention that.
That's good, man. And Albert Bourla, because of your forced booster, is going to get
He's willing to donate boosters 5 through 22.
Yes.
He's not.
Actually, no, he's taking it all and funneling it into another diamond nipple ring because you know he's got diamond nipple rings. And on that note, Marty.
Okay, great to see you
Every time you
guys.
come here, I am filled with joy.
It's a pleasure, Marty.
Great to see you,
Great
Vinay.
to
Great
see you again.
You too.
And guys, if you haven't checked out our latest VP CD episode, it just dropped. So we'll put that out. We'll put this out. That's it, dude. I mean,
good.
This was fun.
Enjoyed it.
That's
Always
we gotta let him
enjoy
out
it.
of here.
Yeah, let him go.
Peace.